Good morning again. Let's get started. Madam Chair, I think we are at quorum. We can start the meeting.
Good morning, everybody. Good morning. Thank you so much for being here today. Sorry, as I pull myself together. Good morning. Welcome. Thank you for being here. Welcome to the Commission for Behavioral Health. My name is Mayra Alvarez. I serve as chair of the commission. Thank you for being with us. Before we get started with our official business, I want to acknowledge how heavy of a morning this is after yet another senseless shooting, and this time at a Catholic school. I was just commenting to folks at the table, not everyone has even heard of this, that it happened. So let me be the one to tell you that 14 children between the ages of 6 and 15 were injured, 3 adults in their 80s attending Mass were injured, and 2 children, ages 8 and 10, were murdered while they were praying. Our gun violence crisis is a policy choice by lawmakers, and as we come together to discuss mental health and behavioral health and the well-being of Californians, we hear often about the impacts of those directly involved, but it's critically important that we not ignore the impacts of such shootings on our collective well-being. And I'm grateful for all of you here who are part of this work, part of this journey to try and ensure that every child, every Californian, every person can lead a life of safety. So thank you for being with us, and please join me in a moment of silence. Thank you. Now we will take roll and establish a quorum. Sandra.
I am asking all commissioners joining us remotely to please unmute your lines and turn your camera on as we call your name and be ready to respond. Commissioner Baer. Commissioner Burnick.
Here.
Commissioner Bontrager. Commissioner Brown. Commissioner Bunch. Commissioner Callan.
Here.
Commissioner Carnevale.
Here.
Commissioner Chambers. Commissioner Contreras.
Here.
Commissioner Designee Swartz. Commissioner Cross.
Here.
Commissioner Fairweather. Here. Commissioner Fernandez.
Here.
Commissioner Gordon.
Here.
Commissioner Designee Pullmano. Commissioner Hill.
Here.
Commissioner Larson.
Here.
Commissioner Madrigal Weiss.
Here.
Commissioner Mitchell. Commissioner Robinson. Commissioner Southard.
Here.
Commissioner Thomas Beckett. Commissioner Sy.
Here.
Commissioner Wilkes. Commissioner Roulette.
Present.
Chair Alvarez.
Here.
We established quorum.
Thank you. Agenda item 2 are our announcements and updates. So let me start by welcoming our newest commissioner, Commissioner Hill. The governor appointed Tombora Hill of Modesto to fill the seat of a family member of an adult or older adult peer with a substance use disorder, which brings our commission to our full membership of 27 members. So welcome, Commissioner Hill. Commissioner Hill has been Director of Compliance and Operations at Strive University since 2024. He was Cal-AIM Business Services Director at St. Mary's Community Services from 2023 to 24, and he's held several roles at Valley Mountain Regional Center, including Program Evaluator for Home and Community-Based Services, Senior Community Services Liaison, and Community Services Liaison. And he was also a special day class teacher at Stockton Unified School District, and as well as at California Youth Authority. He earned a Bachelor of Science degree in Business Administration from California State University, Stanislaus. I invite you, Commissioner Hill, to please say a few words.
I just want to say thank you. I'm honored to be here, and I'm happy to serve, and I look forward to all of the good work we're going to do. Thank you.
Appreciate that. Thank you for being with us. We look forward to working with you. And I am going to take the opportunity to appoint Commissioner Hill to the Legislative and External Affairs Advisory Committee. So thank you for your service. Our second announcement offers an opportunity for us to hear a bit more about the new business operations of the Commission. As we have discussed, the Commission instituted a committee structure for this year in order to have the time to move forward key priorities while offering additional opportunities for public input and discussion. This is something new that we are trying, at least for many of us on this commission. We have not operated under a committee structure. So we welcome the feedback both from our commissioners that are participating in these committees, as well as members of the public, as we seek to refine this process to be successful for the work of the commission overall. So now I'm excited to hear updates about each of our new committees as they have now had all of their inaugural meetings. And we'll start first with the Legislation and External Affairs Advisory Committee, and I'll turn it over to Chair Bontrager and Vice Chair Callan.
Happy to take several mics. No, just a quick summary. We had our first meeting on June 19th, where Deputy Director Zoller did a nice job really presenting the overview, the charter of the committee, the structure. We also heard a presentation regarding our advocacy programs and a new opportunity for the TAY population coming forward. Our next meeting is on the 18th of September, so just around the corner. But I do believe one of the big items we tackled was really creating a decision-making framework. You know, when Deputy Director Zoller told me that there's literally hundreds, if not thousands, of bills that are presented in the State House each year, it's like we need to have some sort of discipline to evaluate what we're going to endorse, and so. I think we have this available, but we really created a decision-making framework to ensure that it's, any bill that we might endorse relates to our work. It's totally in alignment with our strategic plan and our values around equity and diversity, et cetera. So we asked all the commissioners for feedback and really evaluated that. So hopefully creating some discipline because we want our endorsement to be meaningful. If we endorse everything, it becomes meaningless, and we want it to be impactful. So hopefully we'll achieve that through this little mechanism. Thanks. Do you want to add anything?
Thank you. And that is a huge point of discussion over the years from the public about the need to have an opportunity to weigh in on that process and what legislation the commission moves forward with. So thank you for the leadership of the committee in moving that process forward. Appreciate you. The Program Advisory Committee convened its inaugural first meeting on July 17th, led by Chair Tsai and Vice Chair Madrigal-Weiss. So I will hand it over to the chair to share remarks.
Thank you, Chair Alvarez. So the Program Advisory Committee, or the PAC, convened our first meeting July 17th. Appreciate Co-Chair Madrigal-Weiss's leadership in that organization as well. During that first meeting, we reviewed the charter, purpose, introduced some of the organizing pillars focused on youth, quality and integration of behavioral health services, as well as workforce. The Innovation Partnership Fund, or IPF, was also a big focus. Sellers Dorsey helped to provide facilitation around a stakeholder process. We've also convened 2 listening sessions so far with the public, one on August 7th, another one on August 13th. We have our 3rd listening session scheduled for September 3rd from 4 to 6 p.m. These listening sessions are really to hear from the community around the PAC, because it is a new process as a whole, or the Provider Advisory Committee, and also to hear around the IPF concept. And so we've been going through a process just to refine what's been developed with the feedback that we've received. Our next meeting is scheduled for September 18th from 3 to 5 p.m. Really would encourage everyone to join our listening sessions, participate. We're still reviewing the concepts that have been shared thus far, and certainly are very open to and feedback. I think that's it.
Thank you so much for the work on the PAC. It's one of the busiest committees, touching everything. Frankly, all of our committees do. But thank you very much for leading a very complicated and inclusive process these last couple of months. Finally, we get to hear about the Budget and Fiscal Advisory Committee, and I'm going to hand it over to Chair Roulette and Vice Chair Contreras.
Thanks so much, everyone, and Chair Alvarez. I want to acknowledge Chair, Vice Chair Contreras, and everyone who's been a part of the committee. We actually convened our 2nd meeting on August the 21st. As a result of that meeting, you will be hearing recommendations from the Budget Fiscal Committee related to the organization's annual budget and 3 other items in which we had a very robust and thorough discussion. Our next meeting is scheduled for September the 18th. At that time, because of the great work done by staff, and I really do want to underscore that, that we will be reviewing a tool that will allow everyone, and especially our stakeholders in the community, to look at all of the contracts that the Commission currently has in operation, where they are in their current status, funding, progress, and even remarks related to milestones. We are very excited about this tool and what it will afford us in terms of understanding the work and the portfolio of the entire Commission. That said, we are very excited about the participation chair that we've gotten from the community around fiscal matters, and the questions and even the engagement from community members. So we're very excited about our upcoming 3rd meeting. I don't know if Vice Chair Contreras, if you wanted to say anything.
I think that covers it. Thank you.
Thank you so much, and appreciate the privilege of covering what is easily the most exciting topic, fiscal and budget.
Thanks so much, Chair Roulette. Appreciate your leadership. Okay, so the next round of committee meetings are all tentatively scheduled for mid-September, and more information can be found on the Commission's website or through the Commission's email sign-up list. So if you have any questions, please don't hesitate to reach out. Our next announcement is a welcoming of a new staff member. I'd like to welcome our new Commission staff member, Joel Lieberman, who joined the Information Technology Service Division in July. Joel is joining us as a graduate student assistant and will be assisting the ITS team with designing and building automation tools and processes. And his current project is developing a framework that will help staff improve productivity and streamline workflows. Joel, you can come to my organization too. In his free time, Joel enjoys scuba diving, so keep an eye out for him in Hawaii. Again, welcome to the Commission, Joel. I don't even see you, Joel, so if you're here. Okay, thanks, Joel. The last announcement, we want to note that the California Behavioral Health Directors Association has their Behavioral Health Policy Conference on October 22nd through October 24th, which is during our normally scheduled Commission meeting. Commission staff sent out a survey to commissioners to see if there is interest and availability to move our commission meeting to the following week on October 30th. Because many commissioners and members of the public that generally attend our meetings will likely be in attendance at that conference. So we're seeing if that's possible. If you have not done so already, please respond to commission staff so we can determine a date and let the public know as soon as possible. Appreciate your response on that. That concludes our announcements this morning. And now we are going to move forward to our caring moment to help us center ourselves on the purpose of our work and the people that we serve. Again, this practice is really meant to remind us of why we do what we do and to share stories or moments that impact others in ways we may not always see and that frankly keep us grounded in the purpose of this work and why we show up. So today we have the opportunity to hear from Commissioner Tsai. Please go ahead.
Thank you, Chair. And thanks for this opportunity just to lift up what is an exciting update, somber but also exciting. And that's some decisive reductions in overdose numbers across various counties in California, Los Angeles, San Francisco, Ventura, just to name a few. This is from 2024, so some of this data, for example, statewide California data, I think is still pending and being finalized. But it clearly demonstrates what has been reported at the national level as well, which is progress being made around fatal drug overdoses and poisonings. In 2023, just to use this as an example, Los Angeles County had over 3,100 drug-related overdose deaths. In 2024, that number reduced by 22% overall and by 37% specifically for fentanyl. A 37% reduction in fentanyl-related overdoses in Los Angeles County. That's obviously just one county. Other counties have also experienced reductions, but this is something for us to celebrate. As we know, overdose numbers have been historic highs for a number of years now. And so, as someone who's been working in the substance use field, finally seeing a plateau in 2023, seeing a pretty notable reduction in 2024 is just heartwarming. Most importantly, behind each of these numbers and percentages, right, is a person, a face, a voice, right? Our mothers, fathers, brothers, sisters, neighbors. And that's just something that I think is worth calling out and remembering. In Los Angeles, we believe we've achieved that result as a result of broad investments across the substance use continuum. Treatment services, harm reduction services, prevention services, things like our fentanyl frontline media campaign, known as called Fentanyl Frontline. We also have our Buy LA for LA resource hub. And so just wanted to lift this up to celebrate this milestone. Also just highlight the work ahead. Overdose numbers still disproportionately impact communities that are lower in terms of socioeconomic status. Overdose rates for Black and Latinx populations are disproportionately high. BIPOC populations, as a result, are disproportionately impacted. These are things that demonstrate that even with the progress, we have work to do. And I think that, one of the things that we'll be talking about later today is how we as a commission can be integrating substance use focuses, inclusive of overdose prevention, into some of the portfolio and the work that we are charged to focus on for the state of California. So thank you for the opportunity. Thank you for all of you who have contributed to this progress that's being made, and let's keep our foot on the gas.
Thank you, Commissioner Tsai. It's too often that we hear bad news these days. So really appreciate you sharing that. And I'll open it up to commissioners that have any reflections. Please, Commissioner Chambers.
I just want to say thank you, Dr. Tsai, as someone that lives in LA County but lost a family member in Alameda County in 2013, and to see the progress and folks like you and all of us that are been doing the work in harm reduction. I know I didn't want to break down and cry, but like I think if Katie, who's her name, you got to say their name, if she had to die for other people to live, for people to get the passion and the grit to advocate for the integration of substance use treatment, I believe, I don't know, I'm lost for words. All I want to say is thank you for sharing that, because sometimes it can be daunting to just like, oh, is it working? Is it working? And that's someone, like I said, someone that's lost somebody in this. I'm happy that other people can live. And Narcan's everywhere. Everywhere I go now, I see Narcan. Narcan would have saved my sister's life, you know? So thank you, and everybody too.
Thank you. Of course.
Thank you. Thank you so much, Dr. Tsai. We in Sacramento County, as many of you know, have launched a program where we're placing mental health clinicians in all of our schools. And our county is going to be working with us to do a pilot program for how we can augment that service at school sites with substance abuse services. So we'd be very honored if you would give us a hand in framing that and planning, because our county is very interested in using those venues to expand their reach.
Thank you. Yes, please.
Thank you, Commissioner Tsai, for sharing that story with us. You closed by saying that we can't take our foot off the gas now, and I just want to highlight the tremendous work that's been done as Los Angeles County is a direct result of the investment and the focus on substance use disorders as a standalone diagnosis and not as a specialty population. And so as we continue to look at SUDs and make investments in substance use disorder diagnosis in individuals and communities that are impacted by substance use disorders, we should look to the work that's done in LA County as an example to ensure that other counties can have the same type of benefit that we've seen in LA County.
Thank you. Yes.
Dr. Tsai, I don't often talk about my son, who I lost on my birthday as a result of substance use disorder and affective disorder. And I want to thank you on behalf of all family members who have navigated this tragedy. It was one of the most difficult days of my life with all the resources that I had. And I felt so awful when I got the news from the hospital that they had my son. Also, on behalf of the memory of Kirkland Roulette, thank you.
Thank you, Commissioners. And thank you, Vice Chair Roulette, for sharing with us. I'm pretty much done for the day. Okay.
Oh, sorry.
We're going to move on to agenda item 3, general public comment. This time,
So sorry. We had Commissioner Southard also had his hand
oh, I'm
raised.
so sorry. Commissioner Southard, please, I neglected the digital folks.
I just wanted to say also to thank Los Angeles County and for the work that you do. My son suffered from heroin addiction in Los Angeles County, received help in a variety of different ways from places, and remarkably, in a miracle, fully recovered and is now a wonderful father and worker. So thank you.
Thank you, Commissioner, for sharing. And thank you for the power of connection and community that really makes a tremendous difference in the work we're trying to do here in California to support the well-being of our communities. Thank you, thank you, thank you. So for agenda item 3, this time is reserved for comments on items that are not on the agenda. All written public comments have been included in the meeting materials, so there are robust set of documents for commissioners based on public comment. But now we have the opportunity to hear live. So Amariani, if you could please lead us into the public comment process.
Thank you, Chair. If you would like a live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. If there are any members of the public using translation technology, please notify the chair and at least twice the amount of time will be given to you during the public comment period. For members of the public in the room, if you have not already, please use one of the green public comment cards located at the front to indicate you would like to make comment on this item and any other agenda item. Members of the public can also email us public comment to be shared at a future meeting at publiccomment@bhsoac.ca.gov. I will now go over the public comment procedure. Once the public comment period for the agenda item starts, we will close the queue, so please make requests to comment at that time. You may request to make public comment by submitting a card, clicking the raise hand icon on your computer or the app, or if calling in by phone, push *9. When it is your turn to comment, I will call you to the podium or unmute your line and announce your name or the last 3 digits of your number. Members of the public should be prepared to complete their comments within 3 minutes or less, depending on time constraints. We truly appreciate your understanding with this process. We currently have 3 in-room comments, and then we have currently no virtual comments. Our first comment is from Joe.
Can you hear me okay? Great. Good morning, Chair, members of the Commission. My name is Joe Banez. I'm with Shatterproof, a national nonprofit organization dedicated to addressing addiction across California and the United States. On that first, I also want to thank Dr. Sai for his leadership for those of us in the substance use disorder community. I want to take this opportunity to introduce myself. Since this is my first commission meeting, I'm relatively new to Shatterproof. I already feel the passion and energy from leaders in this room, and I've had a chance to cross paths with some commissioners already. More importantly, as behavioral health leaders yourselves, wanted to make sure you are aware of a DHCS-funded SUD treatment locator available to Californians across the state, and that is treatmentatlas.org. So just quickly about me, I'm a family member of a person in long-term recovery from a substance use disorder. I've worked in this field now for over a decade. Like you, Chair, I'm an HHS alum. Prior to coming to Shatterproof, I was with the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, where I led the agency's legislative and external affairs teams. There, I was involved with initiatives like the launch of 90-Day at the federal level, and I've also served in similar roles at the White House Office of National Drug Control Policy, under an individual we are proud to call the nation's first recovery czar. Serving in these ways is in my roots, and I hope to bring that mindset to California, to Shatterproof, and to you as a thought leader, and be a thought leader with you. More about Shatterproof: we work to promote equitable access to evidence-based addiction treatment, advocate for those in need, and work to end the stigma associated with substance use disorder. Shatterproof works in partnership with DHCS on this substance use disorder treatment locator, Treatment Atlas. Treatmentatlas.org is a free resource that helps people find appropriate treatment to fit their individual needs. We include treatment facilities on Treatment Atlas at no cost to any treatment provider that is licensed or certified with DHCS. As you know, offering access to reliable information is an important step in supporting an individual's recovery journey, and Treatment Atlas is designed to make that easier and more transparent. I'll share that last year, over 500,000 Californians used Treatment Atlas. This year, we are already on track to surpass 1 million users. And that isn't just a number. That's 1 million potential moments of hope and potentially 1 million steps forward collectively for our state. In closing, I ask you to take this moment to visit treatmentatlas.org, to text it, email it, share it with a loved one or a neighbor or colleague who might be in need. If you know a licensed or certified provider, ask them to complete the Treatment Atlas survey if they haven't already. And again, know that I'm eager to support the Commission's work, because to me, Californians deserve to know about your decisions, your hard work, and the services you help to ensure the state delivers. So I applaud what you've achieved so far. I look forward to supporting the work ahead, and thank you for your commitment to those with substance use disorder across the state. Thank you.
Thank you. Our next public comment is from Stacy.
Good morning, Commissioners. Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition, and also Safe Passages. I want to give a special welcome to Commissioner Hill, and also I still feel I don't know the other new commissioners, and I really want to welcome you and tell you how much I'm looking forward to working with you. And I know, most of you know, I come up here to talk kind of an awful lot, and I feel sometimes bad about that. But I really want to tell you that it's a new day for this commission. You know, ever since the beginning of this year, I have been coming to these commission meetings probably longer than maybe even a lot of the staff. I've been coming since 2006, and I've attended most of the meetings. And I cannot tell you how delighted I am, how excited and how hopeful, because the staff is really making this commission something it was not before. It is so professional, it is getting so organized, it is getting so open to public comment. Well, I shouldn't say that. There were periods in the very beginning when it was very open to public comment, and it was professional too, although it was difficult because they only had literally 2 staff. 2. Can you believe it? But I just want to thank all of you commissioners and the staff, and you, Chair and Vice Chair, because you're special. And I really want to congratulate you and tell you, I know I'm sorry that I come with a lot of suggestions, but this commission has so much promise with you new members, and I can tell you from the bottom of my heart, it's a new day, and you'll hear me make a lot of comments, but again, Rusty Selix, my old boss, who is the co-author of the original Prop 63, he believed in this commission, and I believe in this commission. You are so important. And again, I just want to say it's a new day, and I know everybody's working really hard. And so even if I do have a lot of suggestions or recommendations, I know it's with just support and feeling like it's a new day. And Commissioner Alvarez, you almost made me cry so thank you for acknowledging what happened, which probably does relate to mental health issues this morning, and Commissioner Tsai for talking about good news. And again, I think as the new person just said, you can tell the commitment and the passion that you all have. So thank you.
Thank you, Stacy. Our next public comment is from Carly.
Good morning, Carly Stelzer on behalf of the California Behavioral Health Association, representing providers serving over 2 million Californians across the lifespan. We appreciate the opportunity to share our public comment with the Commission. First, we want to express our concerns for the recent passage of Federal Bill H.R. 1 and the trickle-down impacts it will have on every area of behavioral health service in the state. We urge the Commission to work with leadership at other state agencies to prepare resources and technical support for providers who have valid concerns about what is to come. We cannot delay our preparation for these major changes, and waiting to see when more guidance will be shared may lead to even greater pain for vulnerable communities who are expected to lose services. CBHA outlined our concerns in a letter sent to Secretary Kim Johnson, and we will include it in our follow-up materials to the Commission. Second, we want to express our appreciation and gratitude to the Commission for the continued support of innovative planning to address behavioral health service gaps. As our system continues to grow and address the demand, these innovative approaches will become even more critical. With continuing threats at the federal level and a state budget facing an ongoing deficit, we will need to become even more creative in our approach to provide essential services. Our members are extremely concerned about how they can continue to serve their undocumented clients under new state and federal rulings. We encourage the Commission to consider how we can innovate our system to continue providing services to all Californians despite these inhumane changes. Finally, I want to elevate for members of the public that CBA hosts the Behavioral Health Transformation Partners Forum on a bi-monthly basis as an opportunity for behavioral health stakeholders from across the state to join, connect, and share updates. Our next meeting is September 10th. You can email me or find me in the room if you would like more information. Thank you so much.
Thank you. And then we have one virtual comment from Dr. Zrule. Your line is open.
Good morning, commissioners. Thank you for opening with a moment of silence to honor that loss. And empathy really has to become a mechanism of access and accountability. I'm Dr. Isratullah Mohammed. I'm a clinical psychologist and author of the Bureau to Custody Cemetery Pipeline and the BDC-3A Pipeline Prevention Model, which was entered into the public record on April 10, 2025. So by way of continuity, in 2024, I met with the chair and commissioners about child fatalities in Los Angeles County linked to barriers to care. The posted record has not yet shown a formal action timeline from those discussions. I really appreciate the more explicit recognition of systemic contributors since my April 10 filing, but recognition without cadence can recreate the conditions we mourn. And while the MHSA has been law since 2004, a renewed 2025 purpose now needs dated public milestones. This is a recognition-only filing. I'm not disclosing any methods or seeking delay, just asking for 3 practical steps that would really strengthen accountability, fidelity, and trust. Number 1, if you can adopt a neutral line of prior work acknowledgement and record accuracy wherever concepts overlap with the Bureau to Custody Cemetery Pipeline, and if you can correct the minutes to reflect that. If you could please also update the May 22 minutes to reflect both frameworks, the Bureau to Custody Cemetery Pipeline and the BDC-3A Pipeline Prevention Model, and post the missing written comments from the May 28, June 17, and July 16 meetings. If you could also publish the new committee design, including charters, membership, meeting calendars, and post agendas. Any recordings retroactively to July. Please also post the August 7 and August 13 listening session materials and a simple action tracker with owners and dates. For each approved item, such as pivot, PADS, EHR, youth self-harm, if you could please publish disaggregated early warning metrics, including disability, foster, housing status, and justice involvement, and a brief note on navigation, so prevention is not quietly replaced by punitive response. Thank you for all your efforts.
Thank you. That was our last public comment.
Thank you, Amariani, and thank you to the members of the public for your comments. Moving on to agenda item 4, we are seeking approval of the May 22nd, 2025 commission meeting minutes. At this time, I would like to invite commissioners to offer comments or ask questions on the minutes. Seeing none, Amariani, if you could please go ahead with public comment.
We do not have any public comment for this item.
Thank you. Now that public comment has closed, I would entertain the motion that the commission approve the May 22nd, 2025 meeting minutes. Thank you, Commissioner Bontrager. Is there a second?
Second.
Thank you, Commissioner Gordon. We have a motion and a second to approve the minutes. Any additional questions or comments from commissioners? Okay. Okay, seeing no more comments from Commissioner Sandra, if you could please call the roll.
Again, remind our commissioners joining remotely to please turn on your camera and unmute yourself so that you are ready to provide a response. Commissioner Bear. Commissioner Burnick.
Yes.
Commissioner Bontrager.
Aye.
Commissioner Brown. Commissioner Bunch. Commissioner Callan.
Yes.
Commissioner Carnevale.
Aye.
Commissioner Chambers.
Aye.
Commissioner Contreras.
Abstain.
Commissioner Designee Swartz. Commissioner Cross.
Aye.
Commissioner Fairweather.
Aye.
Commissioner Fernandez.
Aye.
Commissioner Gordon.
Aye.
Commissioner Designee Pulmano. Commissioner Hill.
Aye.
Commissioner Larson.
Aye.
Commissioner Madrigal Weiss.
Aye.
Commissioner Mitchell. Commissioner Robinson. Commissioner Southard. Commissioner Southard. Are you on mute? Is he muted?
No, he's there.
Commissioner Southard? Okay. Commissioner Thomas Beckett? Commissioner Sy?
Aye.
Commissioner Wilkes? I'm sorry? Was that Southard? Hello? Commissioner Southard?
Yes.
Great, thank you. Vice Chair Roulette?
Aye.
Chair Alvarez?
Aye.
We have the motion is approved.
Thank you. We're going to move on to the consent calendar. This month's consent calendar includes 6 innovation proposals. All matters listed on the consent calendar should be routine and non-controversial, and hopefully will be acted upon in one motion. The first 2 innovation proposals are from Los Angeles and Contra Costa counties, which are both requesting to join the Program Improvements for Valued Outpatient Treatment, or PIVOT project.
I probably should recluse myself for conflicts. I don't know if I should be in this conversation. Like,
It's a consent calendar, so you would just recuse yourself from the whole vote, because you can't do item by item, but that's fine, no problem.
so should I step out or no?
No, it's really high level. I don't really talk detail, and you're not voting. Actually, you know what?
There is a vote for the consent calendar. So I would just say that, the detail, you're going to be stepping out for this vote because you give your reason, and we will call you back into the room after the vote is held.
Okay, I'm going to step out because of this vote, because of financial conflicts.
Perfect.
Thank you, Commissioner Chambers. Anybody else? Okay. So the first 2 innovation proposals, again, from LA and Contra Costa for the PIVOT project. You all might remember this project was originally brought forth by Orange County and approved by the Commission in November of 2024. It aims to prepare counties for Prop 1 implementation. Specifically, these 2 counties will focus on full-service partnerships, developing capacity for specialty mental health plan services, and innovative approaches to delivery of care. In addition, Contra Costa County is also targeting CDEPs, housing solutions, and workforce initiatives. The third innovation proposal is another from Contra Costa County. They're requesting to join the Psychiatric Advanced Directives Phase 2 Multi-County Collaborative. Again, Phase 1 of this project was originally approved by the Commission in June 2021 and focused on creating partnerships, training, and toolkits for county implementation of psychiatric advanced directives. And Phase 2 goals will include live testing and evaluation of the processes put in place during Phase 1. And the 4th and 5th innovation proposals are from Kern and Imperial counties, who are requesting innovation funds for Phase 2 of the semi-statewide Enterprise Health Record Project, or EHR project. Phase 1 of this project was brought forward by Tulare County and approved by the Commission in June 2022. And since then, 12 more counties were approved for Phase 1 of the EHR project. Phase 2 is now seeking to build upon the successes and challenges that were identified in Phase 1 of the EHR project. As a result of feedback from stakeholders from various participating counties, the contractor for this project, CalMesa, has developed two key components with this project to support counties. One being policy implementation support, and two being enhanced data analytics and dashboarding. What is that? Let me tell you. The policy implementation support will provide support, guidance, and training by technical subject matter experts for key policy changes that impact county local service delivery systems. This is attempting to allow counties to successfully adopt policy solutions without interfering with delivery of care. And then the enhanced data analytics and dashboarding provides counties specific dashboards that provide insights on the county's service delivery, fiscal health, and program operations. The county's ability to monitor these dashboards will allow for a greater ability to make informed decisions. So those are two opportunities to strengthen the work that counties are doing, led by CalMesa. And then lastly, Shasta County is requesting innovation funds to empower youth, teachers, school staff, and parents and caregivers to engage in suicide prevention discussions and provide community members with the appropriate knowledge and resources for early intervention when needed. The project goal is to reduce self-harm and suicide rates while increasing mental health literacy and resilience. All these innovation proposals align with the Behavioral Health Services Act and include plans for sustainability. And commission staff have sent the documents related to these projects to the commissioners, and a copy of the staff analyses for the proposals have been provided in your packet. At this time, that's a lot of projects, so I would like to invite commissioners to offer comments or ask questions about this package as a whole. I don't see any questions. So Mariani, let's go ahead with public comment, please.
We have no public comment.
Thank you, Mariani. Now that the public comment period has closed, I would entertain the motion on the screen. I'll make the motion.
I'll second.
Thank you, Commissioner Larson. Thank you, Commissioner Madrigal-Weiss. We have a motion and a second. Any additional questions, comments, reflections? Okay, Sandra, please call the roll.
And again, commissioners joining in online, please unmute your lines and have your camera on as I call the vote. Commissioner Bear, Commissioner Bernick,
Yes.
Commissioner Bontrager,
Aye.
Commissioner Brown, Commissioner Bunch, Commissioner Callan,
Aye.
Commissioner Carnevale,
Aye.
Commissioner Chambers. Oh, sorry. Commissioner Contreras,
Aye.
Commissioner Designee Swartz, Commissioner Cross,
Aye.
Commissioner Fairweather,
Aye.
Commissioner Fernandez,
Aye.
Commissioner Gordon,
Aye.
Commissioner Designee Pomano, Commissioner Hill,
Aye.
Commissioner Larson,
Aye.
Commissioner Madrigal-Weiss,
Approve.
Commissioner Mitchell, Commissioner Robinson, Commissioner Southard,
Yes?
okay, thank you. Commissioner Thomas Beckett, Commissioner Sy,
Aye.
Commissioner Wilkes, Commissioner Vice Chair Roulette,
Aye.
Chair Alvarez.
Aye.
The motion passes.
Thank you very much. And now we're moving on to agenda item 6, the advocacy spotlight. As a reminder, at each of our meetings, we are inviting one of our contracted advocacy organizations to share with the commission the work they are doing to provide advocacy around the state on behalf of and with our marginalized communities, our vulnerable and often underserved communities. The commission has advocacy contracts with organizations that represent the needs of a number of communities, including consumers, diverse racial and ethnic communities, families of consumers, immigrants and refugees, K through 12 students, LGBTQIA+ communities, parents and caregivers, transition age youth, and veterans. All of these populations experience unique behavioral health challenges that are rooted in systemic, cultural, economic, and social barriers. And our partnership with these organizations intend to uplift these communities through advocacy and empowerment and through local behavioral health planning and state level policymaking. So we really value the partnership with our advocacy organizations. So for our advocacy spotlight, I'd like to welcome representatives from the National Alliance on Mental Illness, or NAMI. We look forward to having you share with us a little bit more about the exciting work that you're doing in our communities. So I'm going to hand it over to you all, please.
Thank you so much. We really appreciate the opportunity to be here today, along with the long-term partnership with the OAC to share more about NAMI and some year one highlights. My name is Nancy Eldred. I'm Vice President of Public Affairs and Advocacy.
Good morning, everyone. My name is Marche Pratt. I am the Vice President of Workforce and Community Engagement.
Excellent. I think I can control myself. Great. All right, so the National Alliance on Mental Illness, or NAMI California, is a grassroots organization of families and individuals whose lives have been affected by serious mental illness. We're comprised of 46 local affiliates across the state and 60,000 active advocates dedicated to ensuring the needs of individuals living with SMI and their families are met. Our priorities include family involvement in treatment, access to treatment, criminal justice issues, housing, and crisis services and support for all ages. Recently, we finalized our 4-year strategic plan with a vision to serve as the leading voice for a full continuum of mental health care, expand the family voice in leading conversations on mental health issues through advocacy, policy, and legislation, and break down barriers to behavioral health stigma and discrimination. A large part of the action that we're taking to fulfill that mission is through our advocacy work. You'll see on the screen we're highlighting our annual Advocacy Day, one of our favorite events of the year. Each year we organize a rally on the Capitol West steps for our NAMI community to unite, and we organize legislative visits for our advocates to meet with their state reps to advocate for their local issues at the state level. In year one, we gathered more than 270 advocates at the Capitol, and we are gearing up for our next event in October ahead of our annual conference. And then we'll switch up the timeline a little bit to be in the spring. And then here we wanted to include some commentary from our Youth Advisory Council member, Glenn Brassington, sharing his experience with NAMI programs and Advocacy Day.
My name is Glenn Brassington, and I'm an incoming undergraduate student at Stanford University and a member of NAMI California's Youth Leadership Council. For the past 4 years, I've worked on organizing youth trainings, workshops, and data research for NAMI California. Most recently, I've been involved in the Youth Symposium and Advocacy Day, which are events made to elevate youth voices in policy conversations and make sure that youth and adolescents have a voice at the table when decisions about mental health are being made. Through some of this work, I've seen really firsthand how important it is to have youth-led solutions and create opportunities for actual collaboration and conversations between youth policymakers and community leaders. Because if youth are some of the biggest organizations or biggest groups being impacted and they don't have a voice at the table, then how can we provide actually good solutions for that community? I really think that by empowering youth to share their lived experiences, we can strengthen mental health systems, reduce stigma, and make a future where everyone has access to the care and support they need. I'll mention 2 of the events that I've worked on that have been most impactful for me and for some of my peers. First, NAMI California's Youth Symposium. Set in Sacramento, 1 or 2 days a week, I invite students from around California to present on projects that they're doing at their schools, talk to industry leaders and experts, and try to learn from each other about what can be done to make a better school environment for each other. Some of the students come from Central California, Northern California, Southern California, but they're all unified by the unique goal that they share to try to make all spaces safer and more comfortable for each other. The second event that I've worked with most is NAMI California's Youth Advocacy Day, where youth and adults meet with legislators and try to lobby them about current ongoing bills and legislation that's going through the California House and Assembly. Through that, it gives students the ability to meet with legislators, express their direct needs, and receive feedback on what they can do and what other things they can support. This is incredibly important, especially for members of lower SES communities, people that are have never been exposed to these areas before. And NAMI California is really giving these youth and people access and opportunities that have never existed before. So NAMI California is just really unique in that it is an organization that is for families of people who are dealing with severe mental illness, but also does legislative work.
And we greatly appreciate Glenn taking time at Stanford Move-In Day to record that for us. Yep. Moving on to more of our action and our advocacy training. We also provide advocacy training through signature programs like NAMI Smarts. NAMI Smarts is a 6-module program that equips individuals with the tools to communicate their stories to decision makers effectively, allowing those impacted by SMI to convert their lived experience into impactful grassroots advocacy to drive policy change for mental health services. In year 1, we held 30 NAMI Smarts presenter trainings across 5 regions, along with 6 family listening sessions in diverse communities and 6 NAMI Smarts leader trainings to amplify our advocacy statewide. And then more on our advocacy education here. We are very proud to be deeply involved in Proposition 1 and CARE Act implementation in California. And on the slide here, you'll see our CARE Act digital binder, which we developed in year 1 to support families and affiliates through the CARE Act implementation process. The binder includes background about the CARE Act, information on filing petition, and support for families, and it's customized by each county to include their personal courts and self-help center information. We received really great feedback from family members that that resource was helpful to them. Also pictured is our BHSA Advocacy Toolkit, which is a resource that we developed for our affiliates to advocate at the local level during the BHSA community planning process. It includes where we believe NAMI programs fall within the new BHSA funding streams and how to advocate locally to ensure that decision makers are aware of the need for family psychoeducation and the impacts that local NAMIs have in their communities. And then along with advocacy, we prioritize making sure we're listening to our families and what they'd like us to prioritize here at the state office. Each year, through our mental health family stakeholder survey, we receive hundreds of responses from peers, family members, and stakeholders. And in year 1, priorities of our families included access to care and services, mental health parity, and family involvement in treatment. And I'll turn it over to Marche to talk more about programs and services.
Good morning again, everyone. Another large piece of our advocacy strategy is through education. Our NAMI signature programming, local affiliates, and educational initiatives have proven instrumental in equipping families with a deeper understanding of their loved one's journey, their unique mental health requirements stemming from their diagnosis, and have effectively connected them with a network of fellow caregivers undergoing similar experiences. In other words, we don't want people to feel like they're alone. Our Family to Family program is a free 8-session educational program for families, significant others, and friends of people with mental health conditions. Designated as an evidence-based program by SAMHSA, it facilitates a better understanding of mental health conditions, increases coping skills, and empowers participants to become advocates for their family members. Psychoeducation training has 4 elements: briefing the individual about their illness or condition, problem-solving training, communication training, and self-assertiveness. All education and training modules are offered at no cost and are taught virtually or in person. We also take action by meeting our communities where they are through regional town halls across the state. These events help foster a broader statewide perspective among attendees and encourage future partnerships across county lines. Each year, we host 2 regional town halls across each of our 6 NAMI California territories through our regional model program. In addition to all of our advocacy work, we also support workforce and community engagement. One of the programs that we're most known for participating in is called CalHope. That's facilitated by CalMesa. We had an opportunity for 9 of our affiliates to form 21 pods or teams to go out and provide emotional support for those who had been through traumatic experiences, including the COVID pandemic, wildfires, storms, and other natural disasters. We also, on the workforce side, are trying to get as many peers, family members, and caregivers in the behavioral health workforce so those voices can be centered there. We do that partially through asking people to be a part of our Medi-Cal peer support specialist training. The training covers the 17 core competencies of peer support established by CalMesa, and our affiliates provide a variety of wraparound services to assist people who go through those trainings into finding employment, including career counseling, job search techniques, resume review, et cetera. We also refer them to support groups and any other practical support that they may need to be successful. Over the past year, we've definitely trained well over 300 people on Zoom and have many, many more to go. One of our favorite programs and most empowering. And our voices have taken enough space now, so we're going to transition it to one of our leaders out in the field. This is Laura, our Executive Director of our NAMI affiliate in San Mateo.
Hi, I'm Laura Palmer-Lohan, the Executive Director of NAMI San Mateo County. I recently attended the Northern California Regional Town Hall, and I just thought it was wonderful. What made it wonderful? Well, the fact that NAMI is a very inclusive organization and invited people of all stakeholders and perspectives and viewpoints. We had other executive directors in the room. We had board members, people with lived experience, members, caregivers. The panel discussions were very timely and topical. As well, they also offered a wide range of perspectives and an opportunity for open dialogue and information exchange. I was particularly moved when I shared my perspective about the mental health care system and how CareCourt has been working in our community. I shared some of my concerns about what I had been hearing from family members. And the judge on the panel, I felt, was very measured in his response and talked about some of the impacts of the law and how it plays out in a person's life who has mental illness, who happens to break the law. And afterwards, we had a really good discussion about what motivated him to do this work. And that was the fact that he had a family member with lived experience and understood the challenges that families face. And in that moment, I realized that NAMI family members and their members with lived experience have a lot of allies out there in the broad community. And this was an opportunity for me to get to know those folks and start to develop a relationship. And one of the things that really motivated me to join NAMI was just the exquisite programming that they have to offer. NAMI offers evidence-based programming, and some people may say, well, what does that mean? To me, it means that NAMI programs work. As a former participant of Family to Family, I was really struck when I learned that participants of Family to Family often have their loved one have an increased or quicker recovery and a more sustained recovery. And the fact that NAMI takes the time to collect that data to show that that education and knowledge really has an impact on someone's life, to me, is outstanding. In addition, I was really moved when our organization reported back to me at a recent Ending the Silence presentation to 90 high school students that 12 students stepped forward after the presentation and self-identified as having mental health care challenges. All of them were assessed by the school counselors, and 3 of them were deemed at high risk. This makes me believe that what NAMI does is so crucial, creating a safe space, providing people with a language and words to be able to describe what they're experiencing, and the fact that they then have the courage to recognize that they're not alone and that they can ask for help. It says to me that NAMI shares the value that hope is stronger than fear, and we provide the resources and education for people to be able to reach out and ask for help. And it also tells me that recovery is possible. And many people do recover. As a family member of somebody with mental illness, the skills and tools that I've learned from NAMI, I have put to use on a daily basis to help my loved one navigate. And I'm pleased to report that they are now pursuing their dreams with vigor. So it's such an honor to be part of this organization, and it's why I chose to apply for the job.
Right, so we were asked to wrap up with some hope and our recommendations. Hope is at the center of everything we do. Lived experience is our secret sauce. So we put those two together as we think about moving forward and ensuring that family voices are always at the table, present, and being heard, and also being active in providing their perspective, and remains at the center of all of our decision making. And also that we're committed to building long-term sustainability to support our families, peers, and communities through partnerships with OAC, as you all have seen through our annual State of the Community report that we provide to you. And then lastly, we want to ensure that our partnerships expand and continue to grow. There was a lot of references here to substance use disorder and other bridges that are going to be built to this committee, and we're excited to be, or this commission, and we're excited to be a part of that. And we always want to make sure that no matter what is happening on the outside world, at the federal level or wherever, we're not going anywhere. We've been here 40 years. We'll be here another 40 or more to stand in the gap for all of those who are impacted by mental illness. So the future is bright, even though the future is challenging, and we're ready for the fight. So we appreciate you all and your time today.
Thank you so much, Nancy and Marche, for your comments and for your partners and their powerful videos. Really appreciate the partnership that we have. Later on, we have a conversation with the entire commission around the value of our advocacy contracts. And I really appreciate your presentation, because we're not only learning about the work that you all are doing on a day-to-day basis, but also how it connects to other related efforts across the administration. Again, giving credit and attention to the work of this commission and the value that this commission provides, the greater behavioral health landscape for California. And I wasn't expecting that. So thank you for even enlightening me. I feel like I learn something new every time we have these types of conversations. So thank you very much for the work that you're doing and for your partnership in the fight that continues, for sure. I'm going to open it up to comments, reflections from our commissioners. Commissioner Chambers, Commissioner Fairweather, Commissioner Mitchell, Commissioner Madrigal-Weiss. Okay, let's start.
I'll be quick because I always got something to say. I'm a peer, I run a peer-run organization. I know about NAMI. I just want to highlight that NAMI was really important in the psychoeducation and the pharmaceutical education relative to my for my mental health treatment. I found a lot of education online from that. One of the things I saw that you guys do a lot of family support, and that's a big part of the work. I wonder how you guys can highlight more of your work, because when my sister died, and before that, we just didn't have anybody helping me or my family with her mental health and substance use issues, and then particularly communities of color. I couldn't find any support groups. So, I'm interested to see how I can just continue to uplift the work you're all doing with families. Especially we're doing a lot of work with psychiatric advance directives. I'd love for you guys to work, because it's an empowerment tool for families and for the consumers. But I really would love to highlight more of any cultural specific work that you're doing around families, because as you know, families really should have a voice, and we are, suffering, and we have different issues. And I think just like Black families, I don't feel like we have really anywhere to go when, our family, I have a niece right now in FSP, and I'm suffering too, and I'm I don't know, so I want to uplift your work, and I hope that you can do more work for Black communities and Black families, because I feel like we're just suffering.
I can provide some comment on that. We are hosting our annual conference this October, and one of the things that we are centering is the Black experience. We have a lot of presenters that are going to be talking about some of the ways to really interact with the community, because one size doesn't fit all. We're a huge African diaspora, and so not everything fits in the perfect box for everyone. So I'll just lift up a movement that is outside of NAMI, but we're hoping to build a bridge across, and that is providing support through our local African American barbershops and beauty salons. it's true in a lot of communities that you tell some of your deepest, darkest personal things to the person that's styling you. But it's particularly true in a lot of our African-American communities. And so oftentimes those practitioners, I will call them, want to help more than just saying, I'm here for you, or just hearing someone out. They want the actual resources to be able to refer people to professional behavioral health therapists and others that they can get that support. And they already have the trust of that individual. And so we can come in and support and help. So there's already a movement here in Sacramento. There's some down south in SoCal and other places. So hopefully we can get in where we fit in and not have a takeover spirit, if you will, but really just kind of be the peanut butter to their jelly and make a really nice sandwich for people to have, to be fed emotionally what they need. So that's one of the things that we've really been working on. We care about every population, and we recognize that the Black voice is very important in being disproportionately impacted. So that's one of the ways that we're supporting. I don't know if our colleagues want to comment on what else we're doing with families.
Back completely, because we're going to be here all day, but I really respect that.
Okay.
I don't know.
It's all good.
And I know about that. That's amazing. I'd love to work with you all more on that too, with the barbershops.
Absolutely.
Thank you, Commissioner Chambers. Commissioner Fairweather, please.
Hi, thank you. Great work, and I just want to acknowledge and thank you for the work that you do with your membership as far as learning how to tell their stories. We rely on people, stakeholders, trauma survivors to tell their stories in order to promote change. And for some, channeling personal experience or trauma into advocacy in itself can be healing, but also it just takes a tremendous amount of work. It's not for everyone, and having that preparation and, beforehand, during, knowing where your boundaries are, having support afterwards when you've pulled that stuff up, preparing people for inevitable, really stupid and invasive questions from bodies and journalists and others, and just, acknowledging, the work that takes, and your training materials. I pulled them up while you were talking, and I'm going to be looking more into them. So thank you, and acknowledging the people who tell their stories.
Thank you for those comments, Commissioner Fairweather. Commissioner Mitchell.
I'll be quick. Thank you for the work that you do. In 2011, when my son first started becoming ill, NAMI was one of the first organizations that I went to, because I had no real understanding of schizophrenia from a family perspective for a 12-year-old kid. So you do support families, and thank you. Thank you for that beautiful presentation. Your work is very, very beneficial to families, because I absolutely use NAMI. I remember the first group that I went to, there was an attorney general who was also in our group. And so, as your president said, we have allies everywhere, but we also have families that, the disease bears no care for what your status is in life. So thank you for the work that you do, because I have used your services.
Thank you, Commissioner Mitchell, for your comments. Commissioner Madrigal-Weiss.
Thank you. I too just want to thank you for your work and your service. I'm in San Diego. We work very closely with NAMI San Diego, and I'm in the County Office of Ed, and we are constantly referencing the services with NAMI. And we share it with our school districts to ensure that they know that they can refer families to NAMI. And also within our County Office of Ed, we're using it as a resource for staff, because I think we just need to really make it common practice to be offering up these services. So it's important. And I could not agree more. My hairdresser knows more than my BFF. So absolutely right on. Thank you.
Vice Chair Willett, please.
Again, I want to ditto what Commissioner Madrigal-Weiss just said, not because I go to a barber. that was something we'll talk about privately. But the Confess Project has been very successful, and it is the Confess Project for commissioners, very successful in Sacramento. One, if I could be a support with you, strengthening the coalition between yourselves, NAMI, because you are incredibly impactful in the community, and the Confess Project. Be glad to do that. Have worked with them for 3 or 4 years. I could cite numerous examples, so I'll just give you one. They helped advance a mental health first aid training that was co-sponsored by Sacramento County and Turning Point Community Programs, an organization that I'm somewhat familiar with. But that was done through the Confess Project, and it is a great project. And just to hear young people talk about the importance of being able to go to a place where they feel acknowledged and safe and talk about what they want to talk about. And oftentimes it is exactly as you said, what's happening at home and what's happening in the area of behavioral health. So again, that project is the Confess Project, but more importantly, NAMI, you are so impactful in this community. Thank you very much for all the things that you do. Your organization has saved lives. I thank you.
I think they're so successful because they add peanut butter to that jelly, you know. I will be using that phrase.
Commissioner Kellen.
Hi, thank you very much. What you're doing is amazing. And I'm just questioning, you know, it's a family disease, and I'm just wondering what, are you having any particular challenges now that the commission can help you with? I'm just, because I know that, you know, is it stigma? Is it more people need to know about it? Workforce? How can we help specifically with any real particular challenges that sort of are broad across the board or in certain areas?
Thank you for your question. I'm Tori, Vice President of Programs and Services at NAMI, California. Just again, a special thank you to all of you for having us here today. So what can the commission do? Well, I think it's, you know, we're fighting stigma every day, like you mentioned, and I think we've made a huge impact and a great movement in stigma, and we're starting to see that. We're seeing it in the law enforcement agencies. We're seeing it within our school districts. We're seeing it within, you know, every aspect of the work that we do. I think it's getting more and more access for individuals for these programs. Peer workforce is a big piece of that. We are doing a lot of training of peer workforce, but trying to get those individuals hired in and actually having the opportunity to utilize those skills and put those skills forward. There has been some challenges with that. We have been thankful to place so many individuals, but you know, there's a lot more that we can do. So it's just spreading. It's consistently spreading those services. Today I heard, you know, who's NAMI? Where was NAMI too, like when I, you know, first needed them? I too identify as a family member. And when my family member was struggling in the beginning, I didn't know who NAMI was. I didn't know who NAMI was until I worked for NAMI, you know? And so every single day we're trying to get out into those communities and spread additional services and have deeper conversations. And for those communities who may not have access or may not be ready to come and talk, we have some additional services. For example, today we mentioned the Black and or African American community. We have a program at NAMI called Sharing Hope. Sharing Hope is a very new program where we go into 3 different communities. The Black and African American community, the Latinx community, as well as the AAPI community. And it's kind of like a non-program, I guess you would call it, because we're there just to have a safe place and have conversations around mental health without feeling that stigma, and just opening up conversation. So for example, we've also had some presentations for Sharing Hope in the Sacramento area at one of our multicultural symposiums recently, where we had individuals come and share those experiences. I, for example, would not go out and present to any of those 3 communities because I don't identify with those communities. So we go out in the community and we teach individuals about the program, and then we educate them to go out and meet their community where they're at. I don't think that answered the question about what the commission can do. You guys are already doing such an amazing job in supporting us, and I just think that we appreciate that partnership and that long-term commitment that you guys have made with all of your advocacy partners, including NAMI, and we really just want to continue that work together, and we'll definitely highlight things that come up throughout the year for sure.
Thank you. And I just wanted to remind that we have the Legislative and External Affairs Committee now. So if there's any legislation you'd like to advocate, you can look at our site and bring it to our attention.
I'll say too, one other way that I believe that the commission could support us is helping educate counties on the importance of family psychoeducation. We're hearing a lot of fear with the BHSA and where things will land, and we're doing our best to equip our affiliates on how to effectively advocate at the local level and really understand the process. But any support that we could get from you during that process would be, we'd be very grateful for.
Thank you. Thank you so much. And Tori, thank you for your comments. You did share more ideas around how the commission can be supportive than you give yourself credit for. Everything ranging from the peer workforce conversation to the need for these discretionary dollars that respond to the needs of community, to the flexibility that you have to respond to your families and communities. Yeah, really appreciate that. And I think this is a question that's been coming up time and time again. Like now that BHSA is here, what does that mean for the greater landscape around behavioral health, the continuum of services that are needed, the role of the commission? These are important questions that as a commission we have to tackle in partnership with our agency partners and with all of you. So thank you so much again. I'm gonna look around to see if there's any other commissioner comments before we open it up for public comment. Okay, Amariani, can you open it up for public comment, please?
Yes, we do not have any in-room comment, and we do not have any virtual comments.
Okay, well, thank you again. Huge thanks to Nancy and Marche and Tori for your comments and your leadership and partnership. I appreciate you all being with here. Thank you. Okay, the next item was a stretch break. But we're running a little bit low on time, so I encourage our commissioners to get up out of your seat if you need it, but I'm gonna move on to agenda item 8. I really, we have to take care of ourselves, so I encourage you to get a snack, go to the restroom, all of the things that stress us out, please, we are in a safe space here, so do what you gotta do to take care of yourself. Moving on to agenda item 8 is our state budget update and approval of expenditures and associated contracts. This is going to be presented to us by Norma Pate, our Deputy Director of Administrative Services and Performance Management. A reminder to both commissioners and members of the public, you can find all of our active grants and contracts on our website under the heading Grants and Contracts. This was and has been an effort to demonstrate transparency on behalf of the commission, to know where our dollars are being spent. And again, if this isn't the information that people need, if we need it shown in a different way, that sort of feedback is valuable for us as we seek to reform our processes and communication moving forward. So with that, I will hand it over to Deputy Director Pate.
Thank you so much, Chair. And I just wanted to say a special thank you to Vice Chair Rolette and to Commissioner Contreras for their leadership on the Budget and Fiscal Advisory Committee. It's been very helpful to have them on the committee and to helping with the budget. Next slide, please. The California budget process starts with the governor's proposal that starts in January of each year. The legislature reviews and revises it through hearings and negotiations. The final budget must be approved by both houses on June 15th and signed by the governor on June 30th. The commission can request budget changes through the Department of Finance or by working with the legislature to discuss new initiatives, programs, and supports. Next slide, please. Just for information, sometimes there's confusion from the public and maybe some of the new commissioners, how the commission is funded. The commission is, the Behavioral Health Service Act is a 1% income tax on personal income over $1 million per year. And so the commission receives 3%, part of this 3% state admin fund for our state operations budget and our local assistance. Next slide. The commission currently has funding for ongoing programs that we currently have, and those include the Mental Health Wellness Act, the Behavioral Health Student Services Act, community advocacy contracts, and budget-directed funding sources such as the FSP program, which is $400,000 annually to support the full service partnership evaluation. Next slide, please. We have our current and one-time funds include, sorry, I think the slides are off. Can you go back one slide, please? Oh, no, forward, go ahead, sorry. The encumbered funds, the commission has funds that are encumbered each year to support our local assistance programs. One of our programs has a 2-year encumbrance period, and that's our Mental Health Wellness Act grant program. But the majority of our budget, the funds must be encumbered each year by June 30th. And next slide, please. And this is a list of our active grants and contracts. These contracts some of these contracts will end at various different years. So starting in 2026, some of our grants will end. And then some of them will go on through June 30th of 2030. Next slide, please. This is an overview of our active funds from past fiscal years. And as you can tell, some of our funding comes from multiple fiscal years, and these programs are still active, so there's still current contracts for us or grants for us that staff are continuing to work on and are funded from multiple years. Next slide, please. And this is our 2024 budget. I won't go too much detail of this because I know that we're running a little bit behind today, but just to kind of let you know that we're on budget. We met our goals, and we had approximately $170,000 left in our operating budget for fiscal year 24-25. And then about $6.7 million for local assistance that's dedicated for projects that are already underway or will be presented to you at a future meeting. Next slide, please. And the budget this year is very similar to last year. It's $47.2 million for the commission, and it's divided up between operating budget, which includes personnel, operations, budget directed, and then also we're continuing to use our staff. Our reduction is $1.5 million ongoing to support the governor's executive order, which it was the same as last year. And then our local assistance funds is still $34.3 million. Our estimates for the 25-26 fiscal year based on our expenditures from last fiscal year. And then the next slide, please. This 25-26 budget also includes upcoming competitive bid procurements for immigrant and refugee advocacy, the Mental Health Wellness Act maternal behavioral health technical assistance, the Mental Health Wellness Act FSP technical assistance, which is the full service partnership, and the Mental Health Wellness Act peer respite program. The commission in July of 2026 we'll start a new Innovation Partnership Fund program. It's a grant program, and those funds will become available. It's $20 million each year for 5 years, and those funds will become available July 1 of 2026. Next slide, please. And, oops, there should have been a slide with contracts. Sorry, I think there's some issues with the slide.
Do you want to reference commissioners to go to page 12 of the budget presentation? It's titled Expenditure Authorization.
There's 3 contracts that were, that when presented to the Budget and Fiscal Advisory Committee, the Budget and Fiscal Advisory Committee heard presentation on 3 contracts and the budget for 25-26. The contracts are the Research and Evaluation Program. There's $97,000 for the Cal BHBC for training and supporting local behavioral health boards and commissions. And that was also approved by the Program Advisory Committee. And then $150,000 amendment to the TIMTOT contract to support ongoing consulting for upcoming competitive procurements. And a $110,711 contract for a 3-year contract for a company called Go Secure to ensure compliance with state and federal standards for our IT services. And then I'm happy to answer any questions that you may have.
Just wanted to make sure that Commissioner Contreras and other members of the Fiscal Committee, Commissioners, we had a very detailed discussion of this item, and it in the discussion, it resulted in the recommendations that are included in your packet, not in the slide. So if any of the commissioners on the Fiscal Committee wanted to make any additional comments, that would be, I think, helpful to the larger commission.
Madam Chair, I just wanted to add to that, so context, especially for the newer commissioners, this budget or this entire committee structure is really a new experiment. In the past, we've had these budget discussions, but they're very detailed. There's not enough time. And I think for the Budget Committee especially, which I sit on, I think this has been a successful early exercise. We spent several hours poring over these details and numbers and budgets and coming back with our recommendation to move for the motion you're going to see. And I just want everybody to acknowledge or understand that that's what's going on here. And so I'd say overall we're pleased with our progress in this direction. And there, because it's an open public session, anybody who's interested gets to participate and understand details. And we still have more plans going forward to make this process better, but I think it was good.
Thank you, Commissioner Carnevale. Commissioner Contreras, please.
I just wanted to second that, and I really wanted to thank Norma and her team. I think that they've really shown up with a real approach towards transparency and trying to build out a process that is iterative. I think over time, it will become clearer and clearer. But from everything from being open to really exploring how we present the contracts at future meetings, to how we go through this budget process. So it was really a learning exercise, but I feel really good about where we landed. So thank you.
Thank you for those comments. Commissioner Madrigal-Weiss?
Well, I'd just like to say that I appreciate the report out. I also appreciate the comments from fellow commissioners. I don't think I've ever seen this in the past, not where we had commissioners review to this level of detail. Normally it would be you, and sometimes I think there was more you wanted to share, and it was a question of timing, which is different. This is about quality, depth, and transparency, where before it was about a timing agenda item. So I am super happy to see this happening, and I think it really does help in building the trust and the transparency, and to know that we have commissioners pouring over hours of this. Sorry, and thank you. So, so awesome. Thank you so much.
Commissioner Margaret O'Rice, you can join our committee.
I'm on another one.
I also want to just make sure that I acknowledge the contributions by Commissioner Gorton. I don't know if you wanted to say anything, but I think it is helpful for commissioners to hear that we were able to unanimously support this proposal. And again, Norma, thank you for the work. Thank you.
No, I concur with all that has been said. It's been very helpful.
Thank you, thank you. And really, this is the goal of our committee structure, is to provide that time and opportunity to delve deeper into this content, because you're absolutely right, Commissioner Carnevale, that hasn't always happened, and we feel like we're rushing through everything. And the budget reflects our values, it reflects our commitments and priorities. And so to have that consistency and to have commissioners weigh in on that, deep appreciation to you all, really, for all of the work that goes on, and of course, Norma and the team. Any other comments from our commissioners before we open it up for public comment? Okay, Amariani, please.
We currently have 2 comments. Our first comment is from Jenny. Oh, if you would like to make public, oh, so sorry. Okay, then actually, I'm so sorry, I had the wrong number. We do not have any public comment.
What did you say?
We don't have any public comment.
Thank you, I'm so sorry. I was clearly doing a side conversation. Thank you. Now that public comment has closed, I'd entertain the motion that the commission adopt the fiscal year 20, oh, it's right on the screen.
I make the motion.
Thank you, Commissioner Madrigal-Weiss.
I'll second.
Thank you, Vice Chair. We have a motion and a second? Roulette. Any additional comments or questions?
I think there was a version control issue because the slides that were coming up were different than the ones.
Speaking to the mic.
Oh, I'm sorry. I think there were some version control issues with the slides because the slides that I have presenting are different than the ones that are showing. So, but the motion should be.
The correct is in the packet, right? So if you look at so just rely on the packet.
Yeah. Slide 14.
Yeah.
Thank you for clarifying, Commissioner Chambers.
Yeah.
Do we need to read
Well,
it
the
out loud?
motion is-
Or are we good? Sure,
Well,
I
the
can read it out
motion,
loud.
no, the motion is correct on both pages.
No, it's not.
It's not?
actually. Sorry.
Okay, can somebody put it up back on? I want to see.
That
Do
one
you
has
want
a
me-
dollar figure. There is none here.
Oh, okay. I will go with the version on, and I'm looking at Prasangi, who prepared it. Which is the motion? You approved which one? Without, in the packet, okay. Okay. Yes, we'll take that down, and I will read the motion, and I will ask for the folks to speak up. That the commission adopt the fiscal year 25-26 commission budget and its associated contracts as recommended by the Program Advisory Committee and the Budget Fiscal Advisory Committee. Do we have a motion?
I make the
Just-
motion. I just
Thank
want to
you.
clarify, if you want to see the dollar amount, because that is important, that is what we are doing. It is on slide 9, lower right-hand side is the box.
And a second, Commissioner?
Roulette.
Thank you. I will now go for the vote, if there's any concerns. But from what I understand, your paperwork has, the charts and numbers are correct, so, okay. Commissioner Bear? Commissioner Burnick?
Yes.
Commissioner Bontrager?
Aye.
Commissioner Brown? Commissioner Bunch? Commissioner Callan?
Aye.
Commissioner Carnevale?
Aye.
Commissioner Chambers?
Aye.
Commissioner Contreras?
Aye.
Commissioner Designee Swartz? Commissioner Cross?
Aye.
Commissioner Fairweather?
Aye.
Commissioner Fernandez?
Aye.
Commissioner Gordon?
Aye.
Commissioner Designee Pulmano? Commissioner Hill?
Aye.
Commissioner Larson?
Aye.
Commissioner Madrigal-Weiss?
Aye.
Commissioner Mitchell? Can you say that again on the mic? Opposed? Oh, approved, got it. Commissioner Robinson? Commissioner Southard? Commissioner Southard?
Aye.
Thank you. Commissioner Thomas Beckett? Commissioner Sy?
Aye.
Commissioner Wilks? Commissioner Roulette?
Aye.
Chair Alvarez?
Aye.
The motion passes.
Thank you so much, and thanks again for the incredible work. We are moving on to agenda item 9, which is an update on the Client and Family Leadership and Cultural and Linguistic Competency Committees. We are going to consider approving the forming of a new committee to meet the needs of the commission as a result of the passing of BHSA and in anticipation of upcoming commission-related efforts, including the implementation of the Innovation Partnership Fund. This is to follow up on feedback we received from our joint CFLC and CLCC listening session in July 2025. The commission will hear a proposal to increase the intention to increase the impact of community voice in the commission's portfolio of work. Before you is a proposal that we will discuss and that we are seeking feedback on. And it is an effort to ensure that we are valuing the time of our public that is engaged in our process, as well as the time of these commissioners. So I'm going to invite Commissioner Rachel Chambers, Chair of the Client and Family Leadership Committee, to provide this update. And I just want to thank her for her partnership. She and I held this listening session in July, and I'm grateful for the back and forth and the dialogue that we were able to have. So please go ahead, Commissioner Chambers.
Thank you, Chair, and I just want to honor your work and your commitment. I also want to, before I have a presentation, just acknowledge the community. I know that there is a lot of concerns relative to this proposal. Like I said, as someone that runs a peer-led organization with a mental health illness and a family member, we believe that a lot of the laws that have been passed in the last couple of years have been really repressive towards particularly clients. And I know that there's a great concern in the community that our voice continues to be reduced. I just want to acknowledge that. But we also want to ensure our commitment to uplifting in the client and family voice, as well as our cultural and linguistic specific communities. I just want to be clear that I do hear the concerns in the community. I also want to uplift the work of the staff. The staff has worked tremendously hard on trying to work this out, and so I really am protective of our staff, so I just want to let y'all know that I really respect what everyone's doing and the community. So I will tell you to go to the next slides, but I'm supposed to say good morning, Chair and Vice Chair and Commissioners. Today I have the privilege of providing an update relative to the CFLC and the CLCC and how we can use these communities to better include community voice in the Commission's work, including the Innovation Partnership Fund and grant programs. Statutory mandate requires that the Commission establish committees that focus on gaining perspective of consumers and family members, as well as reducing disparities within certain demographics, geographic regions, and other communities. The history. The Commission has made a commitment to including perspectives from diverse communities and those with lived experience. And if Myra wants to give a shout out to the CLCC, but me before I became a commissioner, and this is going off script, but before I became a commissioner, I was a member of the CFLC, and past Commissioner Tamplin and the late Commissioner Tina Wooten were chairs. This commission has been chaired by individuals with lived experience and have fought for initiatives like the peer respite for people that are Black and brown with that just don't fit the mold of the traditional individual. So I just want to give reverence and respect to the work that this commission has done and how we've uplifted individuals with lived experience to really be able to, just uplift the client voice and individuals that are from disenfranchised communities. Next slide. The commission's role and procedures reads that the commission may establish committees to provide these value perspectives, provide guidance, review materials, and make recommendations. Next slide. Currently, the commission has 2 committees to meet this mandate: the Client and Family Leadership Committee and the Cultural and Linguistic Competency Committee. These committees have 14 members each and are chaired by commissioners and represent diverse populations in the community. Next slide. In July 2025, the committees held a joint listening session to discuss how we could improve the collaboration between the committees and the commission, how do we strengthen the advisor role of the committee members, and how we can improve focus on underserved communities, and how do we elevate the value of lived experience. Next slide. Oh, wait, maybe not next slide, sorry. We heard from the community that they want to be more involved. The community wants more involvement with the direct impact of the work of the commission, and I applaud the community for that, including the Innovation Partnership Fund and the competitive procurement process. And really, I don't know if this is the next one about go to the next slide. And the next slide reads, go back, thank you. And I really want the commissioners to really feel this. Like, do we believe that recovery is possible? Do we believe that consumers have a voice in this? And we, as consumer movement, believe nothing about us without us. Nothing in the system should be created without us. And we believe that a lot of things have been created without us. And with the passing of the Behavioral Health Service Act, there's a focus on including the community voice in the community planning process. This resulted in a call to elevate the voice of those with lived experience and to ensure relevance, equity, accountability in the state's behavioral health system. More now than ever, we really need the voice of our diverse communities and our individuals and families with lived experience. Next slide. Specifically, BHSA identifies the following priorities: those with serious mental illness and severe substance use disorders who are chronically homeless, experiencing homeless, or at risk of homelessness, are in or at risk of being in the justice system, are reentering from the community from prison, jail, or a youth correctional facility, at risk of conservatorship, are in the child welfare system, and at risk of institutionalization. Those are all things that really resonate with me and my family. In order to serve these priority populations, the Commission needs to adjust how our approach is to include the many voices as possible in an efficient way. Next slide. This proposal is to create a committee called the Client, Family, and Community Inclusion, Lived Experience, it's long, and the Diversity Advisory Committee. The goal of the committee is to build on the work and the feedback of the CFLC and the CLCC, responding directly to our statutory authority, values, and addresses the BHSA priority populations. This committee will be designed to focus on including individuals with lived experience in the commission decision-making. Next slide. The commission believes that this will allow a broad representation of community members most impacted by behavioral health issues. This approach allows the commission to support increased collaboration, transparency, accountability through regular meetings that include advisory capacity. This committee can be the voice of the development of the Innovation Partnership Fund and ensure inclusions of a lived experience and diverse community perspectives in that fund. Next slide. Next steps. The next steps would be to combine the CFLC and the CLCC members and appoint new members as needed to ensure specific expertise. The first meeting would be in September 2025, a formal member recruitment in 2026. Next slide. The motion would be, and I don't know if I'm supposed to be reading these motions, or do I read them? Okay. The motion would be that the commission, or should I just read that? Oh yeah, that the commission establish a client, family, and community inclusion, lived experience, and diversity advisory committee. And that's the end of my presentation. But I really, once again, I know that there's public comment, been getting a number of emails, because I want to be transparent with the rest of the commissioners that the community is pretty engaged and active and have, concerns and opportunities that they want to highlight. And so I'm open to hearing, and I'm excited to respond directly to the community. And I just want people to know that this committee changed my life as a as a community member, it allowed me to be an advocate, and it gave me a seat at this table right now. So I believe in the strength of the commission. I believe in the strength of our committees. And this committee is right now bringing major investments into the lived experience workforce and for diverse communities. So it's really important. I think it's the lifeblood of our commission. So I see why there's a number of comments. I'll stop talking now. I appreciate the time and thank you.
Thank you, Commissioner Chambers, for your presentation and your continued leadership. I want to support you in this proposal as your partner in leading these committees over the last couple of years. I've had the honor of serving as chair of the Cultural and Linguistic Competency Committee and have deeply appreciated the time and commitment of the members of that committee, and also have sensed their deep frustration of what it means to be a member of that committee and what is the impact that membership on that committee means. And this is an effort to make that clear, that we value your time, we value your expertise, and it will weigh in on the priorities that are in front of the commission. The issues that our committees, our fiscal committee, our legislative committee, our program committee are tackling, so too would this committee. It is a proposal, and because of that, we are seeking feedback in order to ensure that we are meeting the intent and purpose behind establishing this type of committee. So with that, I think I want to open it up to our commissioners who have questions, comments, reflections, curiosities about this structure, and appreciate the public for being here and being part of this conversation with us. So commissioners. Commissioner Carnevale, please.
Just a couple of thoughts. I mean, as my business perspective is that, you know, we make the customer at the center of everything we do. That's what makes business successful. And in that context, this to me is absolutely right. We need to be tripling down on our elevating the voice of all of the communities that exist in California that need mental health services, which are unfortunately growing every day. And so it seems like the debate here is a little bit about the structure and do we combine and so forth, but I hope we don't miss the fact, I assume all the commissioners agree this is an essential process. In fact, in the future, I hope to lean into with some technologies to suggest we can do even more to enhance these processes and get even more voices broader and more effectively and more efficiently into this public body. And so I just wanted to reiterate that I personally really support and the journeys that people struggle. This is a system that's very hard to work with, and we, the commission, has this unique voice that doesn't exist in most of our government systems. So I think we need to honor that.
Thank you so much. Vice Chair, please.
Certainly, I want to first begin by saying that I had a brief time on the Cultural Competence Committee, and it was chaired by the chair. And certainly during that time, what I appreciated most was the importance of the work. I have always appreciated the work of peers and people with lived experience and family members, always. And so I asked just again, and I know you've considered it, so that's why I asked the question. I would anticipate, given the number of people who I think want to make public comment, that there is some question about diluting one committee and the importance of a committee when you combine. And this is, again, in part, a bridge to Commissioner Carnevale's point. In no way do I envision that it does that. But if you could speak to that and why you think this will not dilute, but in fact raise the importance and significance and impact, if you could do that, albeit a bit extemporaneously, I would appreciate that, and I think members of the public would, and certainly as I think there are other commissioners here who would appreciate it. So the question for you, Commissioner Chambers, is how does this combination of the committees increase the impact, this new committee? How will it be more impactful?
Do you want to go first or respond? I believe that the issues intersect. I mean, many of our vulnerable populations that are family members and clients are of diverse geographic and demographic and linguistic communities. So I fight for both issues, and I believe not to dilute one or the other, but I believe that we can maximize our capacity and voice. When me and the chair, I think we had 2 joint meetings in our time. I thought it was one of the most synergistic, as a macro practitioner practicing now, and I thought it was one of the most synergistic spaces to be in, to hear the diverse voices and to be able to be a partner with the community. And I just felt we had more power. But that was my perspective. I know that others might have other concerns. I do hear the concerns about our client and families and the cultural and linguistic. I mean, I'm telling you, like, as you know, a lot of clients and family members are concerned in small CBOs about the client voice with all these new laws that are being passed. So I want to be able to hear the community, but I also want to maximize and be efficient with our time to ensure that we have a quorum, that we can utilize with the proposed members, that we really start to get our boots on the ground and do the work. And so that's my vision, and I thought it was, like I said, synergistic when we met. But I don't know if Myra Chair has any other things to add to that.
Yeah, I have a couple of thoughts. One is building on, the power of coalition building and intersectionality, absolutely. But also moving from listening to action, listening to our community and doing something with that information as a result. And that's what we're seeking with this committee, is to identify opportunities for this committee to weigh in on the decision-making process that is in front of the commission, related to the Innovation Partnership Fund, related to our advocacy contracts, related to Mental Health Wellness Act moving forward. These are all critical programs that are under the jurisdiction of this commission, and now we have direct opportunity to have public weigh in through committee structure in our decision-making process. So that's a concrete opportunity that did not exist before, right? Not to mention, the details on the RFPs that we would weigh in before, things like that. That's one. And then I think the second one is, again, there are opportunities to further refine this committee structure. So if there is a need to have a subcommittee of this committee to delve deeper into specific issues of a population, that is part of our committee structure. That is allowed. That is part of the feedback that we expect to receive from our committee members in order to be responsive to their leadership and to their input. So it's not set in stone. And I know that that's difficult sometimes because we're approving something and we're thinking that it's going to be the end all be all, and it's absolutely not. As I hope you have seen, even with our committee structure, this is a work in progress that together we will figure out. And that's the purpose and intention behind establishing these new committees, is to try and have a process that we can follow, that people can then hold the commission accountable to. So hope that answers a little bit. Commissioner Fernandez.
Thank you, Commissioner Chambers.
Oh, I'm so sorry, Commissioner Larson and then Commissioner Fernandez.
Thank you. I just wanted to, first, thanks. I can tell that this is a heavy topic and that I see all the hands up, so I don't want to talk too long. In thinking, as we think about the future of this committee and the membership, and I wholeheartedly agree that we need to elevate lived experience at all costs. And as we think about the priority populations within BHSA, that is our job. I would encourage us to think about the membership of this committee reflecting the lived experience of the priority populations. So formerly homeless individuals, former foster youth, former, justice involved, all of the above, because I think those voices are the ones we can learn the most as we're making our decisions around funding, programming, advocacy. And so just really hope that the future membership is reflective of those priority populations.
Thank you, Commissioner Chambers. I think that your explanation was extremely helpful for me. In reviewing the membership of the new proposed committee, I'm just curious, sort of on 2 points. Is sort of one, like, what's the process look like for establishing membership of the committee that's proposed if there are sort of a number of new members? And two, is there at least, somewhat equitable representation of individuals who have a lived experience of a substance use disorder versus a serious mental illness?
Well, I think the structure right now kind of already has some of those folks. I know that we can appoint members as well, right? I think I went through an application process. This was years ago. So I'm sure we can go, Sandra can tell us what the law is, but I think there's multiple ways. I think the application process, and then I know that I appointed recently Carolina Ayala, a substance use peer who runs an organization formerly homeless, just as involved. So I think that there's multiple avenues, and Sandra legally can say, what it was, but that's the process. And I think that we can imagine and come together and figure out, if there's a better way to do that and to lean in on other commissioners as well. But yeah, that's the process that, I went through as a committee member.
And I just confirm that the committee has flexibility in establishing how to create the membership. So it can be application, it could be nomination process. So definitely, as we progress, we can live and learn and adapt what best process to use.
I think it's helpful only given some of the comments from Chair Alvarez around the potential impact that this committee could have in terms of the decision-making around the Innovative Partnership Fund or some of the Mental Health Wellness Act. I think that it's important that as we sort of carry out the intent and spirit of BHSA, that it's reflected in the committee membership as well.
Thank you for that. That's a great flag. And I will emphasize, these are committee members of the CFLC and CLCC that exist today, with a couple of additions, again, to meet subject matter expertise that we really needed to have on this committee through the rest of this year for 2025. And in full transparency, and the public knows this, but I want to remind the commission, there is a lot going on right now between now and the end of the year in order to prepare for 2026. So to not have a formal committee means we're missing a formal opportunity to collect that input. Can we have listening sessions galore? Absolutely. We can continue to have listening sessions. But this is, again, a formal structure to receive public input that we can then take as recommendations from the community. So again, between now and the end of the year, this is the committee, and then for 2026, we can reopen that application process as we see fit.
And I do want to just note, to piggyback on Chair Alvarez's comment, that the process that was followed was surveying all members to see if they wanted to participate only for 2025, right? Just for the remainder of the year, because we're at capacity this year and we have 16 members appointed or to be appointed.
Other comments, reflections from the commission? Please.
I just wanted to say I really appreciate the thoughtfulness around this. And I think that elevating this committee to, we've really coalesced around budget legislation, the PAC committee. And I think this takes us to the next level around lived experience, around our consumers. And I think it's the piece that's missing to this degree. So I think formalizing it is important, and I think it really does fill in a space at a more, bringing it to where we prioritize the budget, the legislation, and the programming. So I think I appreciate the work both you and Commissioner Chambers have done, and Commissioner Larson, and just lifting this up for us. So thank you.
Thank you, Commissioner Madrigal-Weiss. Amariani, let's go.
Okay, so we currently have two in-room comments and a good amount of virtual comments. Our first comment is from Jenny.
Good morning. My name is Jenny Bayardo. I'm the Executive Officer of the California Behavioral Health Planning Council. For those of you who are not as familiar with us, we are an advisory body with mandates in public law and state statute to advocate for persons with lived experience of serious mental illness, children with severe emotional disturbance, and their families. And so we would just like to encourage the commission to reconsider the consolidation of these two groups. We have been hearing a lot from the public about concerns about the loss of a consumer voice, as Commissioner Rowlett referred to. And some of the main concerns that we are hearing is that the two groups are very different. So the stakeholders in the client and family and consumer group and your stakeholders in the cultural competency group are very different. And so there are concerns about the voice of persons with lived experience and their family members getting lost. So I'm glad to hear that you guys are aware of that, are taking that into consideration, and we would strongly encourage you to reconsider. There are a lot of people who feel unheard right now with all the recent legislation that's being passed, and there is a sense of mistrust for those of us, myself included, in state bodies who are not hearing them. And so we are trying to be very considerate of this at the council, and we encourage you also to be considerate of this at the commission. So thank you.
Thank you, Jenny. Our next comment is from Stacy.
Stacy Hiramoto with REMCO, the Racial and Ethnic Mental Health Disparities Coalition, and Safe Passages. I speak for many. We strongly, strongly oppose this. This will not increase the input and the voices of people, of the community stakeholders. I don't understand some of the arguments that have been made. Yes, the purpose of this committee may be slightly different than the CLCC and the CFLC, but you could just have those committees do what you're going to have this one jam together committee do. So I don't understand, again, why you couldn't have two committees. Even on the CLCC, of which I go to the meetings, you already have a large diverse, you have BIPOC and you have LGBTQ. Within those communities are so much diversity. On that committee, you also have rural communities, immigrant and refugee communities, older adults, and then people within, again, I represent the cultural the California Reducing Disparities Project. There are so many communities that feel unheard. This is not going to make them feel more heard. We do not oppose joint meetings. That's fine. I do think that the emphasis, there is overlap, but the interests and the emphasis of consumer and family members and the Cultural and Linguistic Competence Committee, they're so different that they're going to be diluted. You just won't have the time. You know, in your bylaws, those are the only two committees that are mentioned by name. It says you can form committees such as the Cultural and Linguistic Competence Committee and the Client and Family Leadership Committee. They are two distinct committees. Again, I don't want to go on and on, but I do not think this will increase the input. I do not believe it will increase the voices, and I hope you listen to the community members. Thank you.
Thank you, Stacy. We currently have 15 comments virtually. Our first comment is from Regina.
Hi, thank you so very much for allowing me to speak. My name is Regina Mason, and I'm the co-founder of a nonprofit agency called the Village Project in Monterey County, California. And we're a agency that is African American serving, and we serve all people that need help. And I want to just weigh in and say, well, first, I just want to congratulate this commission for the way it looks. I see people on there that mirror the state of California, people of color, and I think you all are doing a stellar job. And so I just want to say that first and foremost. But I'm opposed to combining the CLCC and the CFLC committees. I believe it will weaken the influence and power of community stakeholders from the BIPOC, LGBTQ plus communities and other underserved communities, as well as those from consumer and family groups. I happen to have, I'm a person with lived experience in terms of family members that are impacted. And I can tell you that in Monterey County, African American people are still underserved when it comes to mental health approaches to working with them. But I also think that combining these two committees will mean less time and attention focused on the unique needs of all the stakeholder groups. And I don't think that our voices should be weakened. And again, I think, I understand the time and all that. I think that these are
Regina, it looks like we might have some connection
I
problems.
think that we need a separate committee. Thank you so much.
Thank you. Our next comment is from Bridget. Your line is open.
Good morning, everybody. My name is Bridget Hengerson. I work with the County Behavioral Health Directors Association, which is a nonprofit association representing the behavioral health directors from each of California's 58 counties, as well as 2 cities. I want to thank the commission for the opportunity to provide public comment today. I'm speaking to state our support for the comments that have come before, especially with Stacey Hiramoto of RIMCO. We also are supportive of her comments in opposition of the motion to create and adopt a charter for a client, family, and community inclusion, lived experience, and diversity advisory committee, which would replace the CFLC and the CLCC. We believe this will weaken the voice and influence of community stakeholders, including those from BIPOC and LGBTQ and other underserved communities, as well as from consumers and families in those communities. And although there may be some overlapping perspectives between the 2 committees, which, I mean, there will be because of just cultural backgrounds as well as others, we do believe that keeping them separate will allow for more equity and diversity in voice. So want to thank you for your time.
Thank you. Our next public comment is from Danny. Your line is open.
Hello, good morning, everybody. My name is Danny Theracol, and I'm with the California Youth Empowerment Network, the CBH stakeholder contractor for transition age youth. And I'm here to speak today in opposition to the proposed merging of the Client and Family Leadership Committee with the Cultural and Linguistic Competency Committee. The Commission's own website describes the Cultural and Linguistic Competency Committee as a body that, quote, focuses on understanding inequities in California's behavioral health system and pinpoint strategies to achieve equity. So in other words, in my opinion, the committee ensures that our most underserved and diverse populations are not only recognized as a priority, but also given a dedicated platform to address the unique behavioral health challenges they face. To put this in perspective, the experience of first-generation American youth are often very different from the general TAY population. I'll share one example from my own life that is common among many first-generation youth, and that is growing up, my siblings and I often acted as translators for our parents. But we're just kids. We didn't have the language proficiency of two languages, English and our home language, to navigate conversations about something as complex and as sensitive as mental health. That's a unique barrier many Tay don't experience, but one that deeply shapes the way first-generation youth access and experience behavioral health supports. That is why it's so important to have a distinct space and platform dedicated to cultural and linguistic competency. Combining this committee with another risks diluting that focus on equity and erasing the specific challenges that diverse communities face. Thank you.
Thank you. Our next public comment is from, sorry if I mispronounce your first name, Miran.
Good morning. My name is Meron. I'm with Cal Voices. So Cal Voices recognizes that the Commission has faced challenge in achieving a quorum, which has affected votes on the Innovation Partnership Fund. But merging the Committee of Cultural and Linguistic Competency and the Client and Family Leadership might seem like a quick fix. Still, it may not address the root issues of participation and engagement. Instead, could the Commission conduct a one-time online vote among the Advisory Committee on the Innovation Partnership Fund? This would offer an immediate solution while maintaining the integrity of the existing committee. Of course, the Commission may need to consult with the legal counsel regarding this option to ensure its compliance with the bylaws, regulation, etc. We think maintaining the Cultural and Linguistic Competency Committee and the Client and Family Leadership is crucial for ensuring diverse representation and making informed decisions. Having said that, we truly appreciate the Commission's tremendous work and thank you so much for all what you're doing.
Thank you. Our next public comment is from Elijah.
Good morning, everybody. Elijah Joseph on behalf of LIVE, LGBTQ+ Inclusivity, Visibility, and Empowerment, the CBH stakeholder contractor representing the LGBTQ+ perspective. We strongly oppose the proposed combination of the CFLC with the CLCC. General client and family issues are different than the unique needs of communities that are marginalized in behavioral health services, such as the LGBTQ+ population. As a Black, Indigenous, and non-binary individual who has personal lived experience accessing these services, I have seen firsthand the need for improvement to cultural competency in the behavioral health field. Providers continue to struggle with linguistic respect for trans and gender nonconforming identities. They struggle with consideration of non-white cultural perspectives in medicine, and they struggle with attention to specific health risks faced by my communities. In our work at LIVE, we hear experiences like this all across the state. With so much work left to be done toward cultivating linguistic and cultural competency in the field, it hardly seems appropriate to combine these two committees, leaving queer and BIPOC consumers with even less of the specific contemplation that we urgently need, especially in the current political climate. While I agree that changes may be necessary, and I appreciate the efforts to do so, maintaining separate committees is essential to ensure that LGBTQ+ voices remain central, meaningful, and impactful in addressing the distinct challenges and barriers that our communities face in accessing quality behavioral health care. I appreciate the opportunity to give this input, and I thank you for your time.
Thank you. Our next comment is from Karen. Your line is open.
Thank you. Good morning. Karen Vicari, Mental Health America of California. We're a peer-run organization. We urge the Commission to preserve both the CLCC and the CFLC as separate committees and ensure that the work of both committees is incorporated into the work of the Commission. As Commissioner Chambers mentioned, the BHSA statute, WIC 5845, specifically names only two suggested committees for the Commission to create, the CLCC and the CLFC. These two committees were specifically called out in statute because they have been foundations of the CBH for many years and because they are separate and distinct committees. In these current political times, members of our culturally and linguistically diverse communities are under attack and therefore experiencing unique needs that are separate and different from the needs of the general peer and family communities. It's very important that the unique needs of diverse communities are not lost by combining these two committees. I would also like to request that the commissioners intentionally incorporate the input from both of these committees into the ongoing work of the Commission. In recent years, under prior leadership of the Commission, The vital work of these committees has been increasingly devalued. The voices of lived experience should be a key component of the work of the commission, and I urge you to keep both committees separate, active, and meaningful. Thank you.
Thank you. Our next public comment is from Alberto.
Hi, good morning. Thank you for the opportunity to speak to you this morning. My name is Alberto Perez Rendon. I'm the program manager for the Prevention and Early Intervention program here in La Clínica de la Raza in Oakland. And I wanted to speak to you to oppose this merger. And the reasons I like to present are first, representation. Even if we were to increase the number of committee members, the merger of these two very different topics, language and culture and lived experience and community, I think will reduce the time, the energy, the effort that we can devote to each one of these two topics. And thus, this will reduce our representation and dilute our voices. And so I'm very concerned about that. I know that efficiency is a big reason why this is being done, but I also want to just call out other reasons why we should consider as we do this. Heart, I think, should be also considered, not just the brains, as we make these decisions. At a time where our communities are under attack, immigrant communities, linguistic minorities, cultural groups, this is a time to double down. And doing this, I think, will reduce our representation and dilute our voices in a time when we need to amplify our voices and increase our representations. And so for those reasons, I would like to, oppose this merger. I'll also say something about the membership proposal in the new committee, and say that I don't see in there any efforts to include precisely some of the groups that are being excluded, like linguistic minorities and cultural groups, ethnic minorities. And so that's a reason for me to be concerned. And yeah, so for that reason, I'd like to ask you to reconsider this merger. Thank you.
Thank you. Our next comment is from Vatana. Your line is open.
Good morning, Commissioner and community members. My name is Fatana Peng. I'm the Executive Director of the Cameron family in Orange County, California. I'm speaking today to strongly oppose to the proposal to combine the CLCC and CFLC committees. I used to serve on the CLCC for a few years and have seen firsthand how critical it is to have separate dedicated process and spaces where the voices of BIPOC, LGBTQ+, immigrant and refugees like me and other underserved community can be truly heard and uplifted. CLCC has always been more than a committee. It is a platform for authentic representation. As you know, within the Asian Pacific Islander community, there are over 35 subgroups, and we want to make sure the representation is there. And this community brings distinct perspectives and need, and combining the committee would risk silencing those differences in the name of efficiency. Let it be clear, this proposal would weaken the influences and power of the very stakeholders the commission was designed to serve. It would mean less time, less focus, and ultimately less impact for communities that are already too often left out of decision making. Representation is not symbolic, it is structural. We need separate committee to ensure every voice is fully heard, not folded in. Please do not allow the proposal to move forward. Please do not silence the voices of CLCCs was created to empower. Thank you so much for your attention.
Thank you. Our next public comment is from Tui. Your line is open.
Hi, good morning, everyone. Good morning, commissioners and community members. My name is Tweedo. Pronouns are she, they, with the Southeast Asia Resource Action Center, or CRAC for short. I am the Senior California program manager here, and also voicing and resonating with our community partners here to please oppose this proposal of combining the two committees. A lot of the reasons for us is similar with Southeast Asian Americans and having so many ethnic groups and diversity. We want to ensure that our voices and our partners' voices are heard individually. And I just want to thank you, everyone, for your consideration and for your thoughtfulness of this process. But we truly hope that this can be more of a collaborative effort rather than combining it for streamlining and efficiency's sake. Thank you.
Thank you. Our next comment is from Elizabeth.
Hello, my name is Elizabeth Bennett, the village advocate in the planning season. I want to express a strong opposition to the proposed mapping of the CFLC and the CLCC. This poses a serious risk to the visibility and the power of community stakeholders, particularly those in IPAC, LGBTQ plus, like other historically abusive communities as well as individuals.
Which is make it very difficult to hear you.
Oh.
I don't know, maybe if you just speak more slowly or if you have another microphone open. Yeah.
Or a possibility to submit your comments in writing to make sure that they're captured.
Okay, I can do it.
Thank you, Elizabeth. Yeah, if you could submit it to our inbox, just because it is really, really hard to hear you over the microphone. Thank you. Our next comment is from Jerry. Your line is open.
Good morning. My name is Jerry Hall, and I'm very concerned. Obviously, the feedback from everybody is loud and clear, but I do think that in society we separate how we look at client, family, and community, and how we look at cultural competency, diversity, and inclusivity. And I think that we look at them separately, and the client, family, community typically is looked at as more ubiquitously, and the cultural competency, diversity, inclusivity are those people. And I think that's one of the problems here is that, and it's a concern that's amplified because of the clear targeting of our Indigenous, Black, Latinx, and other people of color, as well as our poor, by our federal government now. And, it seems that the concern is that we need to have a more integrated look at or a more integrated committee that's focused on, all of these topics. And perhaps that's something that the group might consider as a biannual or a triannual meeting that's an integrated committee that takes the work of these two committees and develops a more integrated, recommendations and policies. One of my big concerns too is that each county is coming up with its own cultural competency plan, but they can often be performative, and counties aren't really held to their, their goals and objectives in their evaluations. And I think that however we end up formulating these groups, that we need to hold counties accountable for their promises to the communities, and if they're slipping, that we need to help support them. But to just allow counties to check the box and meet their requirement to come up with a cultural competency plan, and then not necessarily follow up and do what they say, I think that's a problem statewide. Thank you.
Thank you. Our next public comment is from Jason.
Hi, my name is Jason Robison. I am a person with lived experience, and that means for me that I am a person in long-term recovery from substance use and that I have experience with the mental health system. It also means that I'm a family member. I work for a peer-run organization in Los Angeles that works with people experiencing mental health issues and substance use issues. And I'm on the board of directors of the California Association of Mental Health peer-run organizations. I'm also a proposed member of the combined committee. And as such, I've been hearing a lot of concern about the weakening of voices on both sides, on both the cultural competency and the client and family leadership side. And I think I applaud the commission. I specifically applaud Commissioners Chambers and Alvarez for getting the input and the process. And my hope is that we have more input and more collaboration to bring specific action items from each group, working what I would hope to be collaboratively to help shape the priorities and the actions on behalf of the Commission for the People of California. Thank you.
Thank you. Our next comment is from Laurel.
Good morning. I'm Laurel Ben Hamida with Muslim American Society Social Services Foundation and REMCO, the Reducing Mental Health Disparities Coalition. I'm also a former member of the CLCC. So I've been looking at this proposal, and at first I thought, well, it's like a merger for efficiency. But you know, mergers for efficiency can lead to diversification, not diversity, but diversification. But then I thought of it from the point of view of an auntie. Aunties are always interested in marriages. So some Indian students, young women, once asked me in a private lunch on their campus, was I for arranged marriage or love marriage? Since I was a guest on the campus, I was a bit nervous about how to answer that in a traditional country. So I answered happy marriage. And that seemed to make sense. So I'm wondering, did this proposal, is it a love marriage? Did it come up from the communities that you're proposing to marry here? Or is it top down? Is it an arranged marriage from the family elders, as it often has been in traditional cultures? And if they're resisting it, if they don't want to be married, which it seems to me is clear today, is it a forced marriage? So that's a really unhappy way to start. Does not bode well. Some love marriages work out, some arranged marriages work out, some do, some don't. But forced marriage is a big, heavy strike from the very beginning. So I'd suggest starting over. Don't have listening sessions. Start over by bringing people to the table and let them formulate a plan that they think will serve them. And it very well may be maintaining the current committee structure as it is. If you do pass it against my guidance, anyway, as an auntie, I would say you're going to have too many people on one committee. Their commitments and their perspectives are going to result in inefficiencies and not hostility, but difficulties, more challenges than you really need. And if it's basically going to be an advisory body for the innovation dollar spending, maybe there's a little bit of sense there, but I would say,
Thank you, Laurel. Your 3 minutes are up. Please wrap up your comment.
if you insist on doing this, I'd revisit it after a year and spend some time and maybe some money to evaluate whether this marriage is working. Thank you.
Thank you. That was our last public comment from the queue. We ask all other comments that were not heard to please, if you would like to submit them to our inbox at publiccomment@bhsoac.ca.gov. Thank you.
I do see 4 comments. No, 3 comments. Can we just go, are we okay to just go ahead and listen to those? Yeah, let's just go ahead and listen to those. We encourage you to send them electronically as well, but let's just go ahead.
Okay. We'll hear from Josephina. Your line is open.
Hello, can you hear me okay?
We can.
Oh, great. Thank you so much. At first, I want to appreciate the commission for this conversation and your thoughtfulness around trying to ensure increased input from the community. The comment that I wanted to make today is really around, well, really, I'm opposed to the combining of the committees. And the reason for that is because of the fear of the dilution of the input and the agendas related to each one of these committees. And we're living in a time where there is a lot happening, and particularly on the federal level, there has been such a retreat from DEI initiatives and cultural competency and consumer rights. And so I just really want to urge the committee to take note of this larger federal context and reinforce California's commitment to the things that we care about, and inclusivity and community input and cultural competency and diversity and inclusion, and hold tight in this moment to these principles and to ensure that these agendas and these priorities are not diluted in any way. Thank you so much.
Thank you. Our next comment is from Joel. Your line is open.
Thank you so much. You can hear me okay?
Yes, we can.
Great, thanks. I
Okay.
know everyone starts that way. I really want to echo many of the comments today, very strongly against the idea of merging these committees. I really appreciated the comments of Alberto Rendon about looking at the heart of this work beyond just the notion of perhaps the efficiency, although I think Lauren had some great points about, are you even going to get better efficiency by combining these? I mean, we know democracy is messy, and having
part of the coordinators need to review if they're going to do it that way. If you want to do it like that,
I'm
About
sorry.
that. Please go ahead.
Yeah, no problem. Yeah, it's messy, right? And while I understand the desire for these conversations in service of action, right, combining these together so you can be more action oriented and efficient, it's tempting. Of course it is. But as several people have commented, now more than ever, we need more voices, not fewer voices at the table. And California does need to be kind of a last line in many ways for celebrating the diversities of our communities and the needs of our communities. I'm a family member and a member of many of the underserved communities in our state, despite my very white lived experience. And I just really want to urge you to be very thoughtful about diluting voices at a time when we need a greater concentration of voices across multiple spaces. You know, I'm fond of the saying, please, I know time is money, but put your minutes where your mouth is, because I know the commission has been so great, and Commissioner Alvarez in particular has been such a great voice for community engagement, and the CBH has been such a place, especially recently, committed to that. Frankly, I was a little shocked when I heard about this proposal because it just seems so anathema to what the work has been. And so I trust that you will listen to these communities, and despite what might be tempting, please choose to keep these very critical voices separate and each heard loudly. Thank you.
Thank you. Our next public comment is from Elizabeth. Please go ahead.
Thank you so much. And buenos dias. My name is Elizabeth Oseguera, and I work with the California Alliance of Child and Family Services, representing over 160 nonprofit agencies providing critical services to system-involved children, youth, and their families across the state. I apologize for not making it in person this morning as I had planned, but I look forward to working with the commissioners to improve the behavioral health access to all communities, and thank you for the opportunity to offer public comments today. We appreciate the Commission looking for opportunities to increase efficiencies and increase community engagement and voices. However, we do not believe that combining these committees will increase engagement. I would ask the Commission to first consider how the combined committee will create time and space to address all the different issues that impact client and families, which differ from those obstacles that the Linguistic Competency Committee explores with the goal of expanding access to BIPOC communities in the behavioral health space. We want to ensure that there is an allocated space that remains central and focused on expanding behavioral health services to diverse communities. There is so much work to be done in this space, especially in light of federal threats. Thus, we ask that you maintain these committees separate so we don't lose any opportunities to focus on the unique needs that these two committees represent. Instead, the Commission can consider expanding membership to these committees or obtaining consultants to help bring the expertise the Commission seeks. If the Commission decides to continue to explore this proposal, I ask the Commission to provide details around the process to apply for the proposed new committee, the goals for the committee, the type of expertise you are seeking, and ensuring that you create space to gather stakeholder input throughout the process to ensure that the important work that these two committees lead can continue to flourish. Thank you so much for allowing me to speak today.
Thank you. Our next comment is from Vanessa. Your line is open.
Hi everyone. My name is Vanessa Ramos, and I'm, Commissioner Chambers, I adore you. I love you so, so much, and I know that your heart is in the right place. But just as an example on how this merger could really impact communities in a negative way, I just want to highlight that the Commission does not have ASL interpretation. While I understand that closed captioning, is something that I'm seeing on Zoom, I think that closed captioning really limits the way that information is felt and understood by deaf and hard of hearing community members. So that's just an example on how behind the cultural and linguistic committee is. So, I understand all this great celebration, but I don't know what we're celebrating. I mean, my apologies, Commissioner Alvarez. I've been a part of this process for many, many years. And as a person with long-term recovery and substance use, I think that rather than combining committees, that this is a time for the committees to actually have to split up and to have specific conversations on what is culture, right? Like what is cultural needs? What are linguistic needs? Those two things are very, very different. When we think about the Client Family Leadership Committee, I'd love to see Commissioner Fernandez lead the way beside Commissioner Chambers. As somebody that has worked with the late Commissioner Tina Wooten, together we drafted up a career path for peers. Since then, peer support has passed through SB 803, and I remain highly concerned that certified peer support specialists are being confused with community health workers, and soon they're going to be confused with RADTs that serve the substance use community. So this is a time for us to really uplift the specific communities that these committees are hoping to uplift. I also want to share that the ways that people access substance use is currently led in a very beautiful way in Los Angeles County through the Reaching the 95% initiative that's now available to so many counties. So rather than, again, combining committees that won the CFLC, they need to understand what substance use alone is, what mental health alone is, the severities of both, and the acuity levels of both and substance use integration into the mental health services oversight and accountability commission. I don't mean to go on a rant, but just to be honest, the mental health community has led the way within the OAC for many years, and it puts the substance use community at a disadvantage to start to
Thank you,
merge
Vanessa. You're
things.
2 minutes up. Please wrap up your comment.
Okay, just wrapping up by just letting Commissioners Chambers know that I love you very much, and I really hope that you reconsider for the community's sake.
Thank you. Our next comment is from Catherine. Your line is open. You should be receiving a prompt to unmute, or you should be able to.
Thank
unmute.
you. Thank you. I received it. Thank you. And thank all of you for the good work you're doing on the commission. You have a monumental challenge. I'm a former director of the Department of Alcohol and Drug Programs when there was such a thing, and also Undersecretary of Corrections. And just wanted for the broader committees that if you're really seeking SUD participation, to consider involvement with CADPAC and with CPAC, two large associations that cover a broad swath of providers and consumers in the SUD space. I know our alcohol and drug folks on the committee know this. I'm really saying this for the benefit of the broader group, that it's a very, SUD is a very diverse community, and I think would have interest in many of the committees that you have established. Thank you.
Thank you. That was our last comment.
Thank you. Commissioner Chambers, do you have anything to? Oh, she's got a mouthful. Okay. Well, I just want to, public comment is closed, and we are moving on to our motion. I just want to appreciate the members of the public that shared their reflections and thoughts. It matters. We hear you. And at the same time, I'm also hearing this deep need for more spaces that provide community access to the administration and the various agencies that are implementing BHSA. Because let me be clear, this commission is one part of the overall administration's commitment to improving behavioral health in California, and definitely around implementation of BHSA. And I feel this huge sense of responsibility on this commission and our committee structure that then absolves other parts of the administration and counties from the responsibility to listen to the very communities that are seeking this commission's space and voice. And I feel that deeply from the public, and I think that's critical feedback that this commission must give to our partner agencies across the administration, to our county partners that are part of this implementation, because as much, I love all the credit and opportunity you are giving the commission, but we are just one part, and this is an effort to maximize the responsibility we know we have to listen to community, to be in relationship with community, and to use the little bit of power that we have to elevate that voice. We hear you loud and clear, and I hope you also recognize that that does not remove the responsibility from other parts of our administration in doing the same. Commissioner Chambers?
Yeah, I just want to echo you, and I appreciate your work, Chair. I also appreciate mostly the community and how you came out. That actually makes me feel proud that we have a space where individuals across our great state come and give their feedback, and it's heard. As the chair said, I mean, we hear you loud and clear. We heard you in joint committee. We heard you in listening sessions. And for me, as someone that identifies with both populations, I take up the mantle to be able to uplift the voices of I believe that of an integrated community. I think there's power in numbers. And I believe that we have a lot to work to be done as diverse communities with lived experience. I think we have more in common than not, and I believe we're stronger together. And I just know the power of this commission and what we can do. And so I'm excited for the next steps. I'm excited to integrate more diverse voices, more individuals from the substance use community, and to use that power to impact the other committee structures. Like, you just see how many people then showed up. Do you know how much power we're gonna have now with this innovation fund and with our procurement process? I mean, I'm overjoyed as a public administrator. So I look forward to our next steps.
Certainly, I want to, especially the new commissioners, the OAC, as I view it, is a state organization. And one of the things that Prop 1 created for some of us who have been here, not me, I have not been here quite 4 years, but it created the question about the viability of the commission and the importance of the commission as the proposition was initially structured. Now, I said that, I did. And later, there were changes that really did underscore that the commission would have a role. And I say that I believe this is an example of one of the very important roles that the commission has as a state agency, that we are a trusted convener, and that people in the community come here and make input and then believe, not just believe, but want us to demonstrate that we are listening. And we do that, or else they wouldn't come back. And that is not their experience throughout, as you said, quite articulately. It is not their experience with the entirety of the behavioral health community. And that's important to me. That is, again, for new commissioners, understanding that when the community speaks like they have today, it's impactful. And we listen. Now, I'm not preaching to the choir, but I want the community to understand we know that going forward, we really have to advance that important role that we have in the state. And yes, maybe ask for more resources, because you can't do more with what you have. You need more resources. And we've got to ask for more resources, because if the community is saying, this is the place where we get heard, this is the place of action, okay, then the other places in the state that aren't responding to the community, give us those resources so we can do the work and get it done.
Commissioner Carnevale.
Thank you, Madam Chair. I certainly second Vice Chair Rollette's comments about more money, but we'll save that for another time. I'm in favor of this combination again. I have to articulate all the reasons other than, it's the input is great, but that's only a piece of the puzzle. The whole part, because we're all talking to each other. I think all of us agree with all the comments, input we get, but the real action happens when it goes out. It's the outcomes that we have with the governor, the legislature, the staff, and all the effort we do. And every hour we add to more input, which we certainly could do more and more and more of, the less we're going to do on the output. So it's a bit of a numbers game, but in that context, I would recommend the following, and I was going to kind of save this, but I think it's worth putting on the table. I think this is such an important issue that we need to put a megaphone on this issue, and the way we do that is with technology. So I would recommend, while if we vote to do this combination or not, I think the committee or some other body here should do a technology review to figure out ways we can bring modern technologies to radically collect the voices in California so that everybody is heard, and we bring that to the table for our advocacy. And I think that's something that can be done with modern technologies that we're not doing today. And I think that's how we can actually do a better job of our job of advocating on behalf of all the disadvantaged populations that are not being well served. Thank you.
Thank you, Commissioner. Commissioner Fairweather, Commissioner Madrigal-Weiss, Commissioner Mitchell.
So I'm relatively new. Well, actually, I've only been to 3 meetings. This is my 3rd. So I'm new. So I don't know what the, sort of institutional memory is of these committees, and I don't quite have a good understanding on the difficulty in maintaining the two, if it's just a matter of resources, time, and capacity. But hearing so much passionate and eloquent opposition to this, especially at this time when the world is quite frightening, I feel like I need more clarity, more of an understanding of like why overruling these concerns is appropriate. And I don't know if that means, more discussion now or tabling it or whatever, but yeah.
Thank you. Commissioner Madrigal-Weiss.
Thank you. I just want to say that, as we're listening, Commissioner Mitchell and I, the importance of both, I understand. As a family member with lived experience, as I sit as a designee of the State Superintendent of Instruction, but also as a family member with lived experience, I can deeply understand how you don't want to lose your voice for that. And I also understand as a practitioner and a family member with lived experience, the cultural competency, how desperately important that is as well. So having said that and hearing all the concerns, I still believe in the motion that we're putting forward because I trust my commissioners, I trust in the process, and I think we have a huge responsibility to all the voices heard that we must ensure that we are not allowing the perception it's either this or that, but and. And I really want to make sure that we are up for the challenge. And hearing Commissioner Chambers, let's do this. I think we are up for that challenge. I think we need to really ensure that we are providing the and here, because I don't want anyone to feel that the voice has been lost, because both are critically important. So any way we can do that together, I'd happily support that.
Thank you. Thank you. Commissioner Mitchell.
Good morning. I think this, or afternoon, I think this is a tough one because I typically don't say a lot regarding these committees, having served shortly as the chair for the Cultural and Linguistics Competency Committee. I understand where the public is coming from clearly, because historically, this is the one committee or the two committees where we have a lot of public members who are appointed. And the process has always been squirrely, for lack of a better term. Like, who do you know? Or do I submit an application? Or, is my application reviewed? What's the process to become a member on this committee? And so I think there's been a lot of misunderstanding, mistrust in the past. And so, Commissioner Chambers, I love you too. I do think that we are working to close that gap. And I think that's a beautiful thing. I do understand efficiencies, resources, and all of that, because these committees in the past have had difficulty in implementation of initiatives. And also, they have been watered down to the extent of being effective in terms of the public having their input into the greater work of the commission, because cultural linguistics and cultural competency, a lot of our policies did not pass through those committees. They didn't. And so the public is saying, hey, whatever you do, we want to weigh in on it. We want our voice to be heard. And so I from that standpoint alone, I believe that the public's voice has to be heard. Like, there are winners and losers. When you have a game, there's going to be a winner always, and there's going to be a loser. So everyone doesn't always get what they want. But I do believe that where we do have the opportunity to continue to increase the trust and the transparency, I think Stacy made all these beautiful remarks regarding how we're moving toward that beautiful place. But I do think that we still should honor the public's input, because we could have brought people here today that said, I totally endorse this recommendation, but those folks aren't here. They didn't show up. It's those individuals who really are opposed to this. And I think we do have to respect that voice. And so from that standpoint, I'm leaning more toward going with the voice of our stakeholders who showed up and passionately spoke against this combined effort. I think that has to be respected, given where we've been. I don't think that we can't do the and. I just think we have to maybe work a little harder to get it done.
Commissioner Contreras.
Yeah, thank you. I just want to really second and appreciate Commissioner Fairweather and Mitchell's comments. I think as a newer commissioner, I too am struggling with the historical context of these committees and whether they've been effective or ineffective in the past. But I think what's clear to me is that there's a lack of trust, like you were saying, Commissioner Mitchell, to move forward to this new structure. I, from my purview, could see this new structure being successful, but I also think the charter is missing, and I think one of the commenters brought this up, missing key information around membership and how do you get on it and who are the different, individuals or subpopulations that we want to be represented on the committee. And I think that in itself could be a move to better aligning what we want to see done and what we have capacity to do, but with that trust, I think. So I think sometimes you just got to go slow to go fast. And I think this is maybe one of those instances where a little bit more work is needed. Although I appreciate all the work that, Chair Alvarez and Commissioner Chambers have done. I understand a lot of time has been spent in thinking it through, but I would feel more comfortable moving forward with it if we did have more of those details ironed out.
I just want to appreciate everyone's comments. And for me, as a starch advocate for all these communities, I believe that now more than ever is time for us to organize and to do the work. And I really am about that work. Everybody knows, I was here all week. I'm committed to public service. Although I didn't necessarily agree with the whole thing, I believe there's power in numbers. And right now, it's attacks on us as a collaborative community of diverse communities of families and individuals with lived experience in the mental health system. And if we don't organize right now and have an agenda, then I just think that we're going to spend more and more time. And we've just spent so much time, and I'm really about that action. But I respect the comments of everyone. And the committees, for me, like I said, as a member, they were super successful. Like Vanessa Ramos said, we provided guidance around SB 803 and the peer certification. We put a $20 million initiative in peer respites and recovery. There's a number of other things that have come out. Really transformational things that have come out of community. I think we'll be stronger together as diverse communities. And I have some of the same reservations, and I respect the vote. I respect the public the most, but I really want, and I encourage everyone that came out to whatever way it goes to please show up or get on these committees because we need you. I need you. I'm fighting every day as a behavioral health practitioner of a program and a Black woman in this space, a family member. And like we said, they're not listening to us. Almost every law, I'm not even gonna go there, but I remember a year and a half ago when a certain law passed, the whole community was against it. And I don't know if the commission heard. I heard, and I voted against it. So I don't know. I really want to be about that action. And I believe that this is a way, while these restrictive laws to conserve and lock more people up are impacting Black and brown individuals, the community and color. And I think that we'll have more power to impact how this funding goes. I think the community is super concerned about this innovation fund and the corporate and private partnerships because of the mistrust that have happened. So, like, why not? I don't know. But I just want to say thank you to the public. Thank you to all the commissioners. And I knew that this was going to be a difficult conversation. And I look forward to us having a vote. I just think that it's time for us to get down to work in these committees.
Thank you, Commissioner Chambers. I'll follow up on those comments and say, again, these next few months are critical to planning for 2026, including the launch of the Innovation Partnership Fund in July, which statutorily, we work backwards from that. We have to have pieces in place. And public comment this fall and public input is particularly important and speaks to the action that Commissioner Chambers is talking about. We can always revisit our structure if things are not working as planned and as intended, to hold us accountable to the commitments that we say we are making with this structure. At the same time, I'm hearing it loud and clear. And Commissioner Chambers, if you would join me, Brenda, I think the commission should send a letter to our Secretary of Health and Human Services highlighting the public comment that we heard today about the importance of hearing from our communities and creating space for that.
And how safe they feel. I mean, I think that this is pretty phenomenal. But I think we need to be partners with the administration and to diversify the spaces so that these voices can be heard across the broader work, to your point.
And I will say, the Secretary Johnson's incredible record of community engagement during her time at the Department of Social Services makes quite clear her commitment to opening those doors of communication. And I think it's valuable feedback that we get in this commission setting that we can continue to lift up. I see members of the legislative staff on the screen. I hope you are hearing this important feedback and opportunities as we think through what the future will look like. This is a really valuable discussion, and we're grateful for the feedback, the questions from our commissioners. But at this point, I do want to entertain a motion to move forward. Oh, I'm so sorry. Do we have more? Commissioner Fernandez, please.
I think sort of the last one, like I so appreciate the public comment, and clearly, there's a lot of sort of energy around this topic, which is exactly what we want from constituents who we're representing. I think, given the comments from Commissioner Fairweather and Commissioner Contreras, I'm curious if there is like a very sort of succinct summary you can provide that would help us understand the historical context where we're sort of seeing maybe the lack of effectiveness that we wanted to see when there was a two sort of committee structure, and what this seeks to cure and alleviate. Because I for those of us who are new or who maybe don't have that historical context, that might help us understand and might even help inform the public as well.
Document? I thought a historical document internally. I thought we did.
Like the accomplishments?
Yeah, I believe we.
Maybe from the listening session that was in July, was it used for that, maybe? Or say?
I don't know if the staff would like to say anything to call you out. Am I unremembering things?
I think you're right. Yeah, it was the listening sessions is what we used it for. So they would be posted on our website under the listening sessions.
So I think we can provide that. I mean, I think, I don't know what else to say besides, it's fair for the newer commissioners to have these questions, and I'm excited to work with you all.
The only thing I will add, and I think it would be helpful if staff could pull that back up so we can send it to commissioners, but also from a budget perspective, from an operations perspective, this commission is now operating 3 new committees, right? Staff are staffing those new committees. Our staff is not growing. Our capacity is not growing. So we are trying to maximize the capacity we do have to use these channels of communication in a better way. And that's the reality in front of us, right? Like we have limited capacity in order to staff all of these committees and also to utilize those processes meaningfully. So this is an effort to do just that, again, for between now and the end of the year, and hopefully revisit the appointment process for new members in 2026. The last thing I want to add is, there was discussion around creating an additional committee of people with lived experience outside of the CFLC and the CLCC. So that would have been another committee, right, to have that, again, has merit, has very important value. And at the same time, is it doable with our capacity in trying to do all of the things? So that's a little bit of context of the now. And I think the paper will give you some historic information as well.
Let me just add to that, because again, you forget that we've been here a while, so we get this whole background. But remember, this body just expanded radically, and this was part of this. This was a piece of many puzzle pieces that we put in place because the governor did not give us any more money. We have a lot more commissioners to support. We've expanded the scope of things that we're focusing on, so we're trying to grapple with all that. And as challenging as that is how to become efficient, but also effective. We can become more effective even if we have to reduce some of the things we do from budgetary viewpoint. That doesn't mean we're less effective. It just means we have to learn to do things differently. But all organizations, most of us, work in organizations where we're forced to get more effective and more efficient every day because there are fewer dollars available. And on top of all that, we're under attack by the federal government and having to come up with more solutions there. So I know this is tough love. Nobody wants to actually do this, but I personally see it as a necessary part of our important budgeting process to be fiscally responsible.
Sorry to belabor this. I understand all of that, and I know that you are all thoughtful people and thought went into this, but since we haven't seen those materials, and I guess it's on the website, but I'm sorry I didn't see, I just feel like I'm not equipped to, with the information that I have. And would there be any harm in just putting this off until the next meeting and providing those documents or whatever? But right now, I am a no.
And that's okay.
Yeah.
That's why we have a vote, right? The challenge with delaying it means we don't create opportunity for public input in the meantime through this committee structure, right? And the IPF, just if you remember the process from last month, in October, we will discuss the Innovation Partnership Fund outline for, correct me if I'm wrong. Actually, will you, I don't want to be wrong. Could you walk the commission through what the process will be in order to release the IPF RFP next year?
Yeah, so just in terms of a time frame, and I think why there's at least an urgency for that piece of it is because the Innovation Partnership, which is one of our big upcoming projects that we're embarking on, we're looking to leverage our committee structures for those IPF feedback and stakeholder input processes. So through the summer, we've been working on a stakeholder process for IPF, which is going into the concept. But the idea is that then once we have a grant concept, which we're expecting in September, then we would then take that grant concept to all the committees that would be meeting in September. So we were hoping to have this committee meeting in September, and then all of the feedback from those committees and recommendations to move forward with the IPF concept for the October full commission meeting that's how the information, the process would flow. And then we would get input from the October full commission meeting from all commissioners and the public to be able to then finish developing that grant concept that would then come forward as an RFP outline in January. Then the commission would vote on that, and we would right afterwards release the RFP for the IPF. The goal is to have the IPF in place by July 1, 2026.
So it's impossible to have the 2 meetings this month before?
We would have to do
Or
it-
to do a joint meeting just for this time?
Yeah.
And
I
get
think-
that input?
Yeah, I think the idea would be a couple things. One was to try to get, I think from my understanding from these committees, we've had a hard time getting quorum and getting enough folks there. And then on top of it, a lot of the content's going to be the same. So, I mean, we can absolutely do a joint meeting for September if needed. But,
That seems like doable.
or 2 meetings.
I think the comment that I just heard is probably one that I haven't heard yet that seems to bear a lot of importance, which is that if the committees in their previous iterations were not able to meet quorum and therefore were not able to effectively push forward any of the change that they desired, then it doesn't make sense to continue forward with that structure. So if that's information that wasn't previously available to all of the commissioners or to the public, then that's something that needs to be understood, that this system is intended to mean that there's more participants that are actually pushing forward and advocating for the change on behalf of the previous committees because the change wasn't happening previously.
You said it differently than I would say it, but I'd say that that's why I keep saying that there's power in numbers, and that I think there's a great opportunity to get some action done, and we don't have enough time. And I love that all those, I think that will show up. So I think, to your point, you're correct, and that's correct summation of what's been happening.
And the new structure does not prohibit the subcommittees being utilized for input. I just want to make that very clear.
That's a great point.
That's a very important point, that the subcommittee structure can be utilized here in this new committee structure.
I'm wondering, and this is just riffing on an idea, but one of the people that provided public comment had this idea of reevaluating this if it moved forward. And I'm wondering if the motion could be amended to say that this will come back to the commission in 12 months or something to sort of reevaluate whether this move to this new structure is really working or not. Could get me there.
Right. I need a motion first, and then that's a very fair amendment, Commissioner Contreras. Yes. Yeah, you could say.
That the commission establish a client, family, and community inclusion, lived experience, and diversity advisory committee, and that within 12 months, an evaluation or assessment of the effectiveness of this committee will be
Conducted or something.
and what is it?
Conducted?
Inducted.
Evaluation.
I like that word. And brought back to the commission
For review.
Like
for
that.
review in 12 months.
I'll second.
I'll read it, hold on, as I said, I'm just trying to, so within 12 months, okay. What I'm going to do is I'm going to keep the original language, have that pull up the motion, thank you, and tack on at the end this new language, so that the original motion wouldn't shift. It says that the commission create and adopt the charter for the Client, Family, and Community Inclusion, Lived Experience, and Diversity Advisory Committee. Now the new language, and within 12 months, evaluate the effectiveness of this committee to conduct an evaluation, or I'm saying of this committee to be conducted and brought back to a future. This would be voting, yes.
No, but would the evaluation include, you could just bring something back to look at it, but what would that say?
To,
People want to make sure it's not permanent.
yeah. So you would say to be conducted and brought back for consideration. Brought back for consideration. Brought back for consideration at a future commission meeting.
It'll be at least 6 meetings. No, in the year. 6 months in 2026. This year, at least 1, potentially 2. Given the level of work.
So in 6 months, there would be 2 meetings,
Probably.
and in 12 months, there would be 4?
8. It's every 2 months, except for here, right, between now and the end of the year, there's going to be 1 or 2, it depends on staff and coordination, but we would like to at least get 2 now. So it's like September, October, November. Can you schedule 1 in November? Right, like that's a tough month, just the holiday period, you know? Yes, please, Commissioner Kellen.
My thought would be to put more of a specific
Is someone in the
time frame. After 2 meetings, we will reconsider, or after 3 meetings, we'll reconsider, rather than just within 6 months. You know, I think it should be, we want to have a certain amount of meetings that we'll know we'll have some data to look at, and specifically put that in.
Commissioner Chambers? I like that idea. 3 meetings? 3 meetings?
So,
Okay.
to bring it back with after 3 meetings, is that the thing? I'll read it again. And okay, can you bring the motion back up the screen?
Sorry, can we just clarify? So we're bringing it back just for discussion or to
Consideration,
reopen?
consideration which would leave the open door to like disband it or change it or modify it.
But right now, if we vote yes, that means this gets merged, and after 3 meetings, there's a reassessment, and we vote again to unmerge or remain merged, yes?
Or change or modify, yeah.
Or say that we need more time? I mean, I guess because, I mean, 3 meetings. But yes, okay.
Okay, so I'm going to repeat the motion that the commission create and adopt a charter for the Client, Family, and Community Inclusion Lived Experience and Diversity Advisory Committee, and after 3 meetings, evaluate the effectiveness of the committee to be brought back for consideration at a future commission meeting. Do I have a motion? Do I have was it Rachel? Oh, Mara seconded? Okay.
Did we specify that the 3 meetings are the committee meetings and not the commission meetings?
Yeah, I'll put 3 committee meetings. Yeah.
One more time, Sandra.
That the commission create and adopt a charter for the Client, Family, and Community Inclusion Lived Experience and Diversity Advisory Committee, and after 3 committee meetings, evaluate the effectiveness of the committee to be brought back, or committee to bring it back for consideration at a future full commission meeting. And I have a first with Rachel and a second with Mara. Okay, we're good to go into vote? Okay, folks joining us online, please turn on your cameras and unmute yourself to be ready for the vote count. Commissioner Baer. Commissioner Burnick. Commissioner Bontrager.
Abstain.
Commissioner Brown. Commissioner Bunch. Commissioner Callan.
Aye.
Commissioner Carnevale.
Aye.
Commissioner Chambers.
Aye.
Commissioner Contreras.
Aye.
Commissioner Designee Swartz. Commissioner Cross. Aye. Commissioner Fairweather.
Aye.
Commissioner Fernandez,
Aye.
Commissioner Gordon,
Aye.
Commissioner Designee Pulmano, Commissioner Hill,
Aye.
Commissioner Larson,
Aye.
Commissioner Madrigal Weiss,
Aye.
Commissioner Mitchell, Commissioner Robinson,
Aye.
okay, Commissioner Southard,
Nay.
Commissioner Thomas Beckett, Commissioner Sy,
Aye.
Commissioner Wilks, Vice Chair Roulette,
Yes.
Chair Alvarez.
Aye.
The motion passes.
Thank
Let's
you.
get to work.
Oh, we're not done yet. Now that the committee formation has been approved, and huge thanks again to members of the public and to this commission for your discussion and really thoughtful questions in this process, and Commissioner Chambers for your leadership. I would like to appoint Commissioner Chambers as chair of this committee. I was going to appoint myself as vice chair since I was on the CLCC, but I want to be respectful of this opportunity. Is anyone really wanting to serve as vice chair? Okay, no one's looking at me. I see you.
Don't put your eyes down now. Brandon? Oh, Commissioner Brandon.
Okay, all right. I will serve as vice chair alongside Rachel.
All right, then, let's go.
I'm not done. Along with the following members, we're going to appoint the following members to serve on the committee, and I want to thank them in advance. The staff have reached out to these committee members, and they are ready and willing to serve. Senait Admasu, President of African Communities Public Health Coalition. Carolina Ayala, Executive Director with the Happier Life Project. Veronica Chavez with Children's Hospital of Los Angeles. Eugene Dura, Licensed Clinical Social Worker and Equity Services and BHSA Manager with Solano County Behavioral Health. Robin Gansweg, Senior Coordinator with Disability Rights California. Jim Gilmer with the Cyrus Urban Network. Nehal Kayali with Access California Services. Richard Krzyzanowski with the California Association of Mental Health Patients' Rights Advocates. Contrena McFeeder, Peer Outreach and Advocacy Coordinator. Susan Wind Novotny, Chairperson of the NAMI Mendocino Board. Larissa Owen, Director of the Children and Family Futures. Jason Robinson, Chief Program Officer with SHARE. Yia Zhang, Equity Specialist with the California Department of Aging. And Richard Saldivar, Executive Director of the Wall Las Memorias. Thank you, thank you, thank you. Appointees will be notified in writing of their appointment to this committee and will be provided with information regarding the first meeting, which is tentatively scheduled to occur in late September. Thank you again. Okay, we are going to adjourn for lunch and closed session, and we will report back on closed session at 1:45. Is that okay? Okay, I just added, okay. Hopefully. Thank you. Thanks so much, everybody, for your patience. We're going to get started. We are coming back. Welcome back. We hope everyone had an enjoyable lunch. Are you ready, Sandra? Okay, I'd like to hand it over to Sandra to please reestablish quorum with the commissioner roll call.
Okay. Commissioner Bear, Commissioner Burnick. Is he participating online? I just wanted to check. No? Okay. Commissioner Brown, Commissioner Bunch, Commissioner Callahan.
Here.
Commissioner Carnevale,
Here.
Commissioner Chambers, Commissioner Contreras,
Here.
Commissioner Designee Swartz, Commissioner Cross,
Here.
Commissioner Fairweather, Commissioner Fernandez,
Here.
Commissioner Gordon,
Here.
Commissioner Designee Pulmano, Commissioner Hill,
Here.
Commissioner Larson,
Here.
Commissioner Madrigal Weiss. Did she step out? Okay. Commissioner Mitchell. Commissioner Robinson. Commissioner Southard.
He's got his thumbs up.
He's got his thumbs up, okay. Commissioner Thomas Beckett. Commissioner Sy.
Here.
Commissioner Wilkes. Commissioner, Vice Chair Roulette.
Here.
Chair Alvarez.
Here.
Bontrager? Oh, I didn't show you, sorry about that.
Still here.
We have quorum.
Thank you, Sandra. Now I have the responsibility of reporting back on our closed session. During closed session, the commission adopted the charter for the Workforce Optimization Committee and created the Workforce Optimization Committee. Before we take a vote, Amariani, please proceed with public comment. Is that right? Yes? Yes. Yes, the charter has been shared publicly. It was part of the meeting materials. Welcome public comment on our discussion to create this committee and move forward with the charter.
It looks like we have no comments for this item.
Great. Okay, now that the public comment has closed, I would entertain a motion that the commission adopt the Workforce Optimization Committee charter and create the Workforce Optimization Committee.
I'll move it.
Second.
So
Thank you.
is that Roulette and who?
Cross.
Oh, Cross, thank you so much. Okay.
We have a motion and a second. Is there any additional comments or questions from commissioners?
Okay, so I move forward with the motion.
Actually, I
that-
just want to say one thing. I want to give just appreciation to this commission for the commitment to this committee. This is a direct response of discussions as commissioners, as a team, as staff, as the public, to ensure that we're doing what we need to do to create an environment that is successful, not only externally with our programmatic work, but internally as well. I just want to commend Commissioner Robinson for his leadership in getting us here. So thank you.
Thank you. Great work, Commissioner.
That the commission adopt the Workforce Optimization Committee charter and create the Workforce Optimization Committee. We have a first and a second. Commissioner Bear. Commissioner Burnick. Commissioner Bontrager.
Aye.
Commissioner Brown. Commissioner Bunch. Commissioner Callan.
Here.
Commissioner Carnevale.
Aye, sorry.
Yes.
Commissioner Chambers.
Aye.
Commissioner Contreras.
Aye.
Commissioner Designee Swartz. Commissioner Cross.
Aye.
Commissioner Fairweather.
Aye.
Commissioner Fernandez.
Aye.
Commissioner Gordon.
Aye.
Commissioner Designee Pulmano. Commissioner Hill.
Aye.
Commissioner Larson.
Aye.
Commissioner Madrigal Weiss. Also not here. Commissioner Mitchell. Commissioner Robinson. Commissioner Southard. Thank you. Commissioner Thomas Beckett. Commissioner Sy.
Aye.
Commissioner Wilkes. Vice Chair Roulette.
Aye.
Chair Alvarez.
Aye.
The motion passes.
Thank you. Now that the committee has been created, I would like to appoint the following commissioners to the committee. This is a continuation of the Executive Director Search Committee. So I very much appreciate the continued engagement and leadership of the commissioners. First, as chair will be Commissioner Jay Robinson. I will be appointed as vice chair, but it is not me as a person, it is a position of the chair of the commission that will be a part of this committee. Let me make that clear. The position of chair will serve on this committee, given the responsibility of the chair of the commission with oversight of the executive director's performance. Additionally, Commissioner Roulette, Commissioner Bunch, Commissioner Cross, Commissioner Southard, Commissioner Madrigal Weiss, and Commissioner Brown will be appointed on the committee. Again, right now, that is the committee makeup, but if there is interest from our commissioners, please let me know. Reach out to me separately. Thank you very much. And now we are going to move back to agenda item 10, which is the Agenda Outlook Commission and Committees meetings. This is an opportunity for the Commission to consider and approve a calendar that aligns Commission priorities with the Behavioral Health Services Act implementation, including grants, advocacy, data, and integration of substance use disorder. As we have talked about a lot today, but repeatedly over the last few months, we're entering a new era of transparency, and the Commission has established several new committees. With these additions comes the need for a revised schedule and a streamlined calendar to help maintain focus and support a consistent cyclical process for the Commission. The goal of this structure is to ensure we meet all fiscal and legislative deadlines efficiently, but also to make the public aware and include the public and engage the public at each step of the process. You're going to hear more about this in the moment from our Commission staff, but I wanted to note that today's agenda includes several high-level discussions, and while we're not going into as much depth as we wanted to given our time constraints, this really is an opportunity to ensure we are creating a consistent process that allows for understanding and engagement by commissioners and the public alike. So stay tuned for more. We're going to hear from Brenda Graylish, Executive Director, and Kendra Zoller, Deputy Director of Legislation and External Affairs. So I will hand it over to both of you to present.
Thank you, Chair. So I'm Brenda Graylish, and I'm the Executive Director for the Commission for Behavioral Health. And as the Chair just mentioned, the purpose of today's presentation is is to really give an idea of the Commission and Committee workflow and proposed fiscal year 2025-2026 meeting plan or calendar, so it really can help anchor everybody to the work that is underway and going to continue throughout the year, the rest of the fiscal year. And then this will also reflect how we are going to be proposing to move forward in future fiscal year planning. So as many of you are aware, the Commission has recently undergone several significant changes, in particular with Proposition 1, expanded our membership from 16 to 27 commissioners, and now we are complete with all 27 of our commissioner positions filled. And earlier this year, as we've been talking quite a bit today, we've established several new committees. So all of these changes collectively create a natural opportunity for building a strong logistical foundation that allows us to manage both our current and emerging priorities while staying aligned with our fiscal year calendar. And the fiscal year calendar is essentially what drives many of our spending timelines. As such, what we're presenting today is an approach to make our meetings cyclical in nature so that commissioners, CBH staff, and stakeholders all know what to expect, when, and where. This predictability will help everyone prepare, contribute meaningfully, and it will keep our work on track. At the onset, I want to note that we are planning to engage in this type of planning process at each spring full commission meeting to plan for each upcoming fiscal year. So basically, we're getting a little bit of a later start this year because this is new and we've just launched all these committees. But the idea is that starting in the spring of next year, 2026, we'll have this kind of a discussion to plan out all of our priorities for the fiscal year to come. But a lot of these priorities will be, again, cyclical in nature because they're just based on the work that the Commission is mandated to do. Next slide. So as a quick reminder of the legal framework that governs us, only the full Commission can take official action. The committees are advisory in nature. They cannot take action, but they can make recommendations to the full Commission to consider. While we already established that committees will develop much of the work that comes before the Commission, we recognize the need for a clear feedback loop, not just for approving or not approving items, but from the very start. This way, commissioners and stakeholders aren't left wondering, where did this come from? So that's what we're aiming to do today, and you'll notice we'll have several high-level discussions planned, which we'll touch on later. So basically, in general, if you look at the Commission committee workflow, the Commission will be providing strategic direction and guidance on key items. The committees can work on and develop those items and then bring it back to the Commission for further development. And that doesn't mean that the committees are prevented from bringing forward new ideas at their own. This is just a general flow. So things could emerge from the committees and be presented to the Commission. But basically, the structure that we're presenting today is designed to guide the majority of our work. And like I said earlier, much of that work is tied to our allocations each fiscal year. And it'll help us get a significant lead on time, given that the CBH staff needs to develop, release, and award many of our grant programs, which we'll also discuss in a minute. So just a reminder, the fiscal year runs July 1 to June 30th. And, you know, in terms of funding, we have to think about, you know, when funds are required to be encumbered, or which means obligated or committed, typically by June 30th of each year. Okay. So now, just to give the commissioners a sense, and this should really anchor and ground you to this is what we're going to see cyclically. So this is our RFPs, our requests for proposals, our RFAs, which are requests for applications, as well as our intents to award. These include our ongoing allocations, which include the Mental Health Wellness Act, the new Innovation Partnership Fund, the Behavioral Health Student Services Act. We have some funding that comes on an ongoing basis for a full service partnership evaluation and our advocacy contracts. We also have legislative items that will come before the commission, which include different legislative reports and positions on bills. We also have budget items that are going to be coming in front of the commission, so our contracts, our spending plans, and our budget proposals, and then other miscellaneous items of business, which includes our minutes, chair, vice chair elections, and just any other items that will require commission approval. So these are the things that you can see on a regular basis. And so in terms of a cadence, you know, I say this is all of our non-negotiable items, you know, and these that we have to do and they're organized by our different committees. So you can see for the Budget and Fiscal Committee, we have the contracts, the spending plans, and the budget proposals. Our Program Advisory Committee can expect to see agenda items on the grant RFPs and intent to awards, research and evaluation efforts, and any other efforts related to data. Our external and legislative and external affairs committee will be talking about bill positions, sponsored bills, advocacy contracts, and communications. And our new CFC will be designed to inform the work of all of the advisory committees meetings. So the recommendation that we're making today is that all of the budget, basically all the budget and fiscal program and leg and external affairs committees meet on the third Thursday of every month, with the CFC advisory committee meeting on the fourth Thursday of every month. And that will allow flow across the different committees. Okay. All right. And I think this is where I turn it over to you, my dear.
Okay, so this is what the fiscal year calendar would look like. We already talked about why we're going off the fiscal year. So you'll see the full commission meets every other month, but skips December and June, July for summer. Those have been months that are traditionally difficult to schedule. So that would be 5 full commission meetings a year. And as Brenda just said, committees in between, advisory committees on third Thursday, new CFC on fourth Thursday. We're trying to continue to hold commission meetings on the traditional fourth Thursday when they occur. And of course, we can schedule more full commission meetings anytime as long as we post 10 days prior for Bagley-Keene. Okay, taking a closer look at our fiscal year requirements, because we have so many grants, it's a lot to get done at once, and sometimes we're right up against the deadline. So we're proposing 2 different tracks. Track A has the RFP or RFA outline to be presented in October, which we hope to do with the BHSSA this year, with the intent to award being January. And then the second track, which our Innovation Partnership Fund would be on this year, would be the RFP RFA outline in January, with the intent to award in March. We think this builds in enough time for committee review, also creates a buffer if more time is needed, if there's some back and forth, but still meet our fiscal year deadlines. And then we hope that each May we'd have a sort of evaluation focus meeting, a check-in to reflect on our programs and progress so far, which would help us prepare for high-level strategic discussions each August. So our rough cyclical schedule would be August, commission provides strategic direction, committees develop proposals and bring them forward. Commission approves or sends them back for more work. And then May, we talk about evaluation, reflection, and the cycle continues. We hope this makes the process more predictable. We're able to plan ahead, stay on schedule, and protect our funding. And so this is what that looks like in terms of dates for 25, 26. Yeah.
Real quick, so in short, this is pretty well thought out. Does this, I might ask a silly question, does this reduce our commission meetings
Yeah.
by like half? Well, because it's committee meetings.
Yeah.
Okay.
And are you intending it still to be one-day meetings?
So far, up for debate. Depending on the work we need to get done, we might propose two. Yeah, the committees would hopefully offset some of the time we spend on agenda items, but there could be times where committees disagree. They might be longer at the full commission, so it could change.
So the history of the commission, this is again for new commissioners, I feel like I have that responsibility today, has been one-day meetings with the exception of the strategic planning meeting, which was actually 2 days. And I would hope that Brenda, you and staff could anticipate when we might need a 2-day meeting. Given the unique complexities associated with quorum here, I can, as I even think about, Chair, the innovation decisions and associated with those funds, and that's really the big bulk of the work that we're going to be doing in front of us. Also, the sustainability finance proposal, forgive me, I don't have the right acronym in my head right this second, but that's going to be a lot of work. If you could let us know in advance so that we can, I don't want to repeat myself, ensure that we meet quorum, what you're thinking about in terms of a potential 2-day meeting. Secondly, I'm anticipating, in the past, we had meetings that were not just in Sacramento. When I came on the commission, we had meetings away from Sacramento. I'm, again, assuming that the 5 meetings would be in Sacramento.
We can talk about that. I mean, I don't know what the committee or the commission preference is. If the preference is Sacramento, I'm.
Well, and vote of one, I would really want the executive director to guide, because Bagley Keenan quorum is really directing a lot of that.
Pretty much, yeah.
And so if having a meeting in Sacramento ensures that we can do our business, then I would vote for Sacramento. Yep. Sorry for all of you who live in LA and other places. But that does seem to be working right now.
Yeah. And the goal is to have, I'm sorry, go ahead.
No, the only thing I wanted to emphasize was, I think that's part of why it's an advantage to have this calendar, because the planning can happen now. I remember the reason why we went out throughout the state was to provide more opportunity for public input for those that were not able to access Sacramento, and I'm mindful of that as we consider our commitment to community engagement. But again, that's what the planning is for. That's the goal here. So good luck.
Yep. Thank you.
I want to second that. I mean, I think that it's important, if we can, to not just be in Sacramento. And since the community just really believes in us and the feedback that the feedback is heard, hopefully there's at least one traveling meeting in an area that, I don't know, that we identify where we can get probably more, I don't know, input.
So Chair, I'll edit my comments, certainly to the degree that we can always ensure that we have the best opportunity to get quorum. That's my, I don't care if you could have a meeting in Napa. I'd love to go to Napa. But we just have to, Commissioner Bontrager likes that, and so does Commissioner Carnevale. But we just have to make sure that we can get quorum. And Chair, I don't want to have the responsibility of ensuring. I think that should be our executive director's responsibility to ensure that wherever the location is, it provides us with the best opportunity to get quorum.
Makes sense.
Other comments, reflections from the commission? Yes, please, Commissioner Gordon.
Just one comment, in terms of adding the extra day to the meeting, if that's short notice, that's really, really problematic, especially if it's a Wednesday. Friday is easier to add than a Wednesday, just saying. But I just want to be present, I want to be participating, but that's tough without adequate notice.
And the goal is to have these be one-day meetings. That's where we're at right
Yeah,
now, so.
yeah. But I
But if we do, it's good to know.
I see the issue.
Good to know.
Just kidding. Hello. Hi, Commissioner Larson, please.
I'm just wondering, I love one-day meetings and I love fewer meetings, so I'm all in favor of this revised schedule. And I love the committee structure and I think it's working well. And we kind of need to update our strategic plan, sorry, to all the old commissioners, but all of us that were added didn't have a voice in that, and it doesn't reflect the BHSA, and that does feel like a two-day meeting, probably, to do a strategic plan, or at least a one-day meeting that's only about the strategic plan, and so I just am saying that out loud.
We wholeheartedly agree. Yes. Thank you for that, Commissioner Larson. Others? Okay, then Amariani, let's hear from the public about this proposed calendar.
We have no comments.
Okay, fantastic. Thank you.
Just kidding. Someone just
Steve.
just raised their hand. Yeah. Steve, your line is open. Sorry, 1 second. Lester, could you unmute Steve? My Zoom isn't working. I'm sorry, Steve, your line is open.
Okay, can you hear me okay?
We can, yes.
Okay, great, thank you. Yeah, apologize. It took me a while to figure out where to put my hand. Hi, my name's Steve McNally. I'm a community member from Orange County. I'm on a local behavioral health advisory board. Just to remind you, does have statutory duties, which would be helpful for you to help reinforce across the state. One benefit that these boards give you is access to 59 elected supervisors who don't see anything from the state, nor do they see it from you, the Behavioral Planning Council, or from other distributions. The reason I bring that up is I'm sure it's easier to have the full commission meet in Sacramento because you have to vote for Bagley Keene, but it would be nice if maybe the committees could get out and about because Southern California, the 4 counties down here represent 45% of California. If we could figure out how to organize, that would be very attractive for public and private money, and it's America's 5th largest state. As the most influential group, I think it's really intriguing to me that the expansion of the group, there were fears about it to some degree, but it's provided new breath and energy into becoming a working group. And I find that to be very helpful for my son who has schizophrenia. And as I go to meetings across the state, people make a difference, people's commitments. Every county operates with the same restrictions, but somehow some counties seem to be able to pull it together and some don't. And we really need to be able to figure that out. So I would just appreciate if you do get out and about, then you have a chance to also provide your influence to the other groups and to tie them up. Because while we still talk about it's getting better, but still we have lots of silos and most of the state meetings are 90% presentation, 10% participation. And then the county does that to the community. And then the system users, they just don't get involved at all. So thank you for letting me share. And I hope you all have a terrific day. And that's all I have to say. Thanks.
Thank you, Steve. That was our last public comment.
Thanks so much, Mariani. Steve, did you have something? I'm so sorry, Commissioner Carnavelli. did you
No,
have
no,
something?
thank you. I hate to do this, but I'm just going to be, I'm going to express my concerns about this. And I'm doing this hesitantly because I'm trying to evolve also in the future. But I look at the past, and one of the beauties of this commission was being a working group. And part of that working group was that we were meeting almost every month. We were traveling a lot. We were doing site visits. There was a real opportunity to mix up this idea of one-day or even two-day meetings quarterly. One of the problems with it is if you miss a meeting, you have literally missed 6 months. And so, I'm willing to try this and whatever everybody thinks collectively, but I am concerned that this is going to lead to a very different dynamic that we've had that has made the commission successful. And so as one of the older ones, I just have to express that reservation.
Can I just add to that? I would like to see some ideas on some site visits. I think it changed, like the commission changed my whole understanding of like the mental health system because of the site visits to the state hospitals. And I mean, I'm doing the peer respite, all kind of stuff. So for people that aren't practicing, that are commissioners, like for them to be able to go like even to the Napa State Hospital or go see, the alcove centers or different opportunities. I'd love to see that. And I think we should maybe increase the number, or go to the larger, go anywhere and have these meetings and work with the local boards. And I'm going to agree too that we probably need more meetings.
Thank you. So I appreciate you all willingness to go along with this, right, and test it out, because this is not like exciting, sexy stuff, right? We're calendaring, this is process, but it's this process and functions that allow us to be more effective with what we're trying to do in our mission-oriented work. So, props to the team for trying to do that and to test this out. And I hear you about the need to talk more regularly and be engaged. And every other month may not offer that, but I also appreciate your willingness to try. And to your point about site visits, completely agree with that. And I hope that this calendar doesn't include that, but it will, right? In alignment with the program committee, the budget committee, the legislative and external affairs committee, so that we have clear processes that allow us to identify what those opportunities should be versus, it's just popping up left and right. And that's what we're trying to do. Again, and that's in alignment with transparency and openness as a commission and with the public. And so just want to express appreciation for your patience and willingness to try new things and to reassess as they move forward and pivot if we need to. Yes, Commissioner Fairweather.
Considering how packed these meetings are, the one-day meetings might be a challenge. And then, so I don't know, I'm sort of, have pros and cons to this. In terms of this year, so it's now September, correct? Yes, no, it's August. So this calendar here is starting, this is like next year. Because this year we would have,
We would meet again as a full commission in October, and there would be committee meetings in September and November.
okay.
We should note, we put December as needed because we want to flag that we may need to meet in December given the business items on the table. Historically, we have not met in December.
Okay, just clarifying.
Great. We need a motion.
Do you want to pull up the slide with the?
Yes, if you could please pull up the slide, thank you. So now that public comment has closed and commissioner comments, I think, have concluded, I would entertain the motion that the commission approve the fiscal year 25-26 meeting calendar for the commission and its committees with the understanding that adjustments may be made as needed in response to unforeseen circumstances.
Second.
Who's the first? Who's the first?
Motion.
Motion.
Motion. Thank you, Commissioner Cowan. Second?
Second.
Thank you, Commissioner Cross. We have a motion and a second.
Great. Commissioner Bear, Commissioner Burnick, Commissioner Bontrager,
Aye.
Commissioner Brown, Commissioner Bunch, Commissioner Callan,
Aye.
Commissioner Carnevale,
Aye.
Commissioner Chambers,
Abstain.
Commissioner Contreras,
Aye.
Commissioner Designee Swartz, Commissioner Cross,
Aye.
Commissioner Fairweather, Commissioner Fernandez,
Aye.
Commissioner Gordon,
Aye.
Commissioner Designee Pulmano, Commissioner Hill,
Aye.
Commissioner Larson,
Aye.
Commissioner Madrigal Weiss,
Aye.
Commissioner Mitchell, Commissioner Robinson, Commissioner Southard,
Aye.
thank you, Commissioner Thomas Beckett, Commissioner Sy,
Aye.
Commissioner Wilks, Vice Chair Roulette,
Aye.
Chair Alvarez,
Aye.
motion passes.
Thank you. And now to our regular order of business. We are going to be moving on to agenda item 13. The commission, for this portion of our agenda, will talk about work in response to implementation of BHSA. So our responsibility now is really to establish a strategic approach to integrating substance use disorder across future commission programs and committee work. As many of you know and are well aware, one of the most significant changes introduced by Proposition 1 and the BHSA is the formal inclusion of SUD. This includes expanded eligibility for BHSA services, not only for individuals with co-occurring mental health and SUD conditions, but also for those whose primary need is related to SUD. We are incredibly fortunate to have numerous subject matter experts and individuals with lived and/or professional experience in SUDs on our commission, including our esteemed colleagues, Commissioner Sy and Commissioner Fernandez. I would now like to invite them to lead this discussion and appreciate the opportunity to be on this learning journey together. Commissioner Sy and Commissioner Fernandez.
Thank you, Madam Chair. Before I jump in, I unfortunately have to leave at 3. And so fellow Commissioner Fernandez will take over if I have to stop through. But we're really excited to talk about the integration of substance use disorders, or SUD, within the Commission's portfolio. And I think in particular, even though I won't be here for this, I'm excited to hear about the discussion after this presentation, because I think the last slide where we asked some key questions, I think, to me, that's where the work will really happen around this topic. Next slide. So just to set things up, why this matters. Sorry, next slide, please. Oh, sorry, we have this. So there's a little bit of data, right? And this is from some of this data is from the Kaiser Family Foundation. Some of this data is from the National Survey on Drug Use and Health. 2/3 of Americans say that they are touched by substance use in some way, whether it's themselves, their family, someone they know. Nearly 17% of people in the United States have had a substance use disorder over the past year. Under 15% of those received substance use treatment, and under 6% of those received substance use treatment within the specialty substance use system. When you think about co-occurring mental health, in particular serious mental illness and substance use, over the past year, less than 3%, right? In terms of treatment access for people with co-occurring substance use and SMI over the past year, 30%, almost 1/3 of those individuals don't receive any treatment at all. Almost half of those individuals receive only mental health treatment. Only 20% or so receive both mental health and substance use treatment, which I would just highlight is the best practice. And only about 2% receive only substance use treatment. And so when I see numbers like this, to me, this is the reason why I'm excited to work in the substance use field, because there is tremendous opportunity. When you think about the margins for improvement, there's a lot of margin here for us to improve on SUD services, on behavioral health services, inclusive of mental health focuses. So BHSA, and some of this was covered in a prior slide, prior presentation today, but just to make sure that we're all grounded in the same kind of requirements. So BHSA targets funding for adults and children who either have the conditions or at risk of the most serious mental health conditions, as well as substance use disorders, which includes substance use as a standalone condition of eligibility. It emphasizes certain priority populations, as was mentioned previously, those who are chronically or at risk of becoming homeless, those who are either within the justice system already or at risk of entering it, as well as re-entering the community from prison or jail, those involved in the child welfare system, and those at risk of conservatorship or institutionalization. BHSA is in alignment with other state efforts designed to integrate mental health as well as substance use services, including CalAIM. When we look at the specific specifications of how substance use disorders are incorporated into BHSA, this is what the next two slides are meant to highlight. And just for transparency, this information is taken from the Department of Healthcare Services at the state. Counties that provide substance use services have to provide all forms of medications for addiction treatment that are FDA approved. They may use BHSA funding to assess whether someone is living with a substance use disorder and to treat that individual prior to a diagnosis being established. They must establish FSP or full service partnership programs that include assertive field-based initiation for substance use treatment services. They must include substance use treatment services in their BHSA integrated plan. They must report annual expenditures of all funds spent, inclusive of substance use services, and including the county behavioral health oversight, county behavioral health outcomes, accountability, and transparency report, otherwise known as BODER. Those are some of the statutory requirements of BHSA. On this slide, we get into how data is used to inform the BHSA integrated plan, because one of the aims is to be more data informed in terms of services provided through BHSA and just throughout the counties as a whole. And so around the data piece, counties must meaningfully engage with stakeholders, including the community planning process. They have to consider relevant data sources, including local data, to inform the prioritization of BHSA investments. This includes mental health and substance use prevalence, as well as unmet need determinations. They have to identify strategies. Counties have to identify strategies to address substance use disparities within that integrated plan. In counties with separate mental health and substance use departments, which is only Los Angeles, both departments will have to work together to use BHSA funding consistent with local data, what the data's telling us. And then DHCS will also provide population-level behavioral health metrics to help inform and shape those services. I think many commissioners know this already, but just to highlight and facilitate our conversation, our commission's purpose is transformational change. We have a couple tools at our disposal, research and evaluation, pilots to test innovative ideas, concepts, and system change, advocacy and legislation, as well as what we spent a fair amount of today talking about, how we can lift up the community voice to solicit participation and help to inform our priorities. To me, one of our fundamental questions with behavioral health transformation throughout California is thinking through how substance use disorders, or SUDs, integrated into our commission's work in each of these areas, right? In my mind, that will be the work of the And so with this, I'm going to pass off the next two slides to Brenda.
this work? Okay, so Brenda Graylish, Executive Director for the Commission. So in terms kind of going along with what Commissioner Tsai was just saying, when we're thinking about integrating SUD into the work of the Commission, just to kind of re-anchor everybody into what that work is that the Commission is doing, we've got our grants and our contracts work. So we have our Mental Health Wellness Act, we have our Behavioral Health Student Services Act, the Innovation Partnership Fund, and the Advocacy contracts. So thinking about SUD within all of those spaces as we think of our planning efforts. We've had special projects over the years. So we've had the workplace mental health, criminal justice projects, coordinated specialty care for early psychosis, the Alcove Youth Drop-In Centers. We've talked about last time at the last commission meeting, the impacts of firearm violence. We've also had the school-based universal behavioral health screening project and suicide prevention projects. So as we're thinking about it, not just thinking in terms of mental health or co-occurring, but in that SUD standalone that Commissioner Tsai was just talking about. We also have consultative roles in the statute for BHSA. So with CDPH, we are in statute as being required to consult, or for CDPH to consult with us on the population-based prevention efforts. And we did weigh in on their first phase of those. Of that effort. And then there's a few for Department of Healthcare Services, and that has to do with early intervention, full service partnerships, and just data and metrics in general. So as it relates to BHSA. Next slide, please. So in terms of just of these and the work, no, let's see, next slide. Go back one. Sorry. Oh, we're going forward. One more forward. There we go. Stop. Okay. So of these boxes on this slide here, the SB 465 was not on the previous slide. That is our ongoing funding that we receive for full service partnerships. Oh, thanks, Gary. For the full service partnerships, the report that we have to do for the legislature. The other three are the grants that were on the previous slide, so you can see which ones are ongoing. But again, through all the work, and as we're thinking as we move forward, thinking about how to integrate SUD into the thinking and the reporting, the work we're doing as we're conceptualizing and implementing our grants and contracts.
Great. So now is the discussion portion. I think these are just some framing questions. We don't have to follow these, although we thought it might be helpful just to frame. And I'll just go through these quickly. So some fundamental questions in our minds: how can the Commission integrate substance use into its portfolio, including grants, advocacy, contracts, legislation, policy, and data? What does reasonable Commission resource allocation for mental health and SUD look like across the behavioral health system? What should the Commission committees consider when trying to implement substance use within each of the committees' work? And then what is a meaningful stakeholder process that incorporates substance use look like within the Commission? And this isn't to say that we're not already doing this, but just to kind of help frame how we approach this. So with that, thank you. Open any comments, questions. And thank you, Brenda.
Thank you both. Commissioner Larson, please kick us off.
Thanks for calling on me. I have said this before in this meeting, but I'll say it again. I was facing a felony at 19, and it was related to my substance use disorders. And I was lucky enough to look like I look and have parents that had money, and so I ended up not with a felony on my record. But that really got me into this field right over 30 years ago, and I started, guess what, in substance use disorder treatment. And it's quite a learning at 22 to be working in substance use treatment. But so this is obviously something near and dear to my heart, and I feel like we do often miss the mark in these meetings when we say behavioral health. I don't think we always really mean mental health and substance use disorders, so I do think we have some work to do. I will say that if we are intentional about aligning our work, whether it be financing programs, advocacy positions, if we align those with those priority populations and include this intention of supporting people living with substance use disorders, we will hit the mark, because we know that when we're talking about child welfare, 75% of those cases are substance use related. When we think about our peoples in jails and prisons, more than 75% of those have substance use issues. When we're talking about our people living outdoors, almost all of them have some substance use, sometimes to survive and sometimes because they have a disorder. But when we think about those priority populations, we know that folks living with substance use disorders are disproportionately represented. And so I just want to like double down on this and remind us all that this is who we're talking about, and they are the majority of our priority populations that we're tasked with taking care of.
Gordon, please.
Thank you. I just want to reiterate what I mentioned before. I think one of the things we ought to be focused on is getting to these issues as early as possible. Often we're so late to the game that the circumstances are so dire that we're really pedaling uphill. So I think teaming up with the school systems, with some serious pilots, because I think the earlier we can get to not just the identification and treatment, but building the awareness of the problem that can evolve with parents and schools, I think are a safe place for kids. There are trusted people there who kids will open up to. So I would just encourage whatever we can do to try some pilots in schools, and not just in high school, middle school, but I think in the elementary grades, as well. And we'd be happy to help in Sacramento County.
Thanks so much, Commissioner Gordon. I think that raises a really good question around this question of where prevention and early intervention lives in this work now that we have priority populations identified. I know it's an ongoing discussion I've had with Brenda, and just in general, where the space for that conversation is, because I don't think it always lends itself to the limited dollars that we have to focus on the prevention that Commissioner Gordon is talking about versus tertiary prevention that others may be referring to. So that's an outstanding question that I think is one that is not the Commission's responsibility alone, let me emphasize that, but does warrant further conversation about what that looks like for California. Brenda, you mentioned our consultative role with CDPH. I think that in and of itself warrants a conversation, what our comments were and why we sent what we did, and how that doesn't get at what Commissioner Gordon is saying. So that's a bike rack issue, but one that is a very important and prominent bike rack. Vice Chair Rolette.
Can I make one comment to that? I think I certainly agree with what you said, Chair. And I think one of the benefits of looking at the financing of how counties finance their behavioral health overall is, even if there are some limitations on the BHSA side with respect to prevention services, the utilization of those BHSA resources could free up other resources for prevention services elsewhere, right? So just to kind of highlight, because certainly agree, we need to be investing upstream, downstream, everywhere, certainly in the middle as well, right? In my mind, harm reduction is kind of in the middle. BHSA is a very important funding stream. I think it's about 25% of behavioral health funding across the state, but there's another 75% there, right? So thank you.
My perspective about the first bullet is threefold. One, I think that there are a plethora of opinions from people who I think are not only uniquely suited, but on the commission because they have background experience, life experience with substance use disorder. As my colleague Commissioner Larson, just shared. And that it is those impactful anecdotes that always help influence and shape how we began to look at the building of a portfolio. And then that leads to the second point, and that is making sure that we make a place to really effectively, Brenda, engage the community in this discussion about portfolio and allowing them an avenue to have input into how we go about developing our portfolio in their state agency. the third point, the reason I made the second point is that the most impactful story that I've ever heard related to substance use disorder actually came in an experience that I had with a student in Sacramento County in K-12 education provided by Commissioner Gordon. And the students said that they were experiencing some symptoms associated with depression and began to use prescription medication to treat that. And that led to other drugs of choice. And when they shared that with the provider said, well, just stop doing it and get better. She said, if I had a broken leg, they wouldn't tell me that.
Mm-hmm.
And it was so impactful that this under 18-year-old person telling me what it felt like to have their substance use addiction just summarily dismissed by a provider. And it is those kinds of, I think, inputs that we need when we begin to build a portfolio that will change how we think about substance use disorder and its integration into our commission's portfolio.
If I could quickly respond to that, Commissioner Rowlett, I think that anecdote that you shared with us is precisely why we're having the conversation here today, and I think it sort of it gets at the point which is the issue of parity and the lack of parity from providers in terms of how they treat individuals with a primary care issue versus a mental health diagnosis versus a substance use disorder diagnosis. And parity, I think, is exactly what BHSA was meant to address through the force of the constituents in California who said we need to be able to fund substance use disorder treatment in line with mental health conditions. And so I think that the topic of these questions really aims to seek from the Commission how we will decide in terms of to what end are we going to actually carry out that mission of establishing parity within the Commission's portfolio. When we use the term behavioral health, are we really talking about mental health and substance use disorders? And I, for one, think that we can successfully fund priorities that address both conditions, and that we're not in a circumstance where funding a substance use disorder initiative means that another equally worthwhile mental health initiative does not get funded. In fact, I think it just requires a revision in terms of what our scope and our priorities are. And so I'm very grateful to hear your comments here today.
Agreed, and while that student would not have articulated and said parity, what the student was demonstrating was the impact of a lack of parity and an appreciation by me of the associated effect of parity. Because what we want to prevent and when we want to intervene and how we want to prevent should be influenced and shaped by the student and the student experience. And ultimately, you said the policy change around parity can be driven in part by the Commission, not the Commission only, but in part by the Commission. I completely agree.
I just say, I mean, my work in practice and representing one of the stakeholder communities in terms of the advocacy grants, veterans, you know, at risk for homelessness, yes. Incarceration, yes. Institutionalization, yes. Mental health, yes. SED, yes. You know, it's kind of all of the above. And to me, like separating, when I first started this, even at the VA, if you wanted to get mental health care, they'd tell you that you had to get clean first. And then people wouldn't get mental health care because they didn't want to get clean, and that was too scary. And then they're all wrapped up together so intrinsically. So it's kind of like a no wrong door, that it is equity and parity of you come in, you've got SUD only, SMI only, SMI and SUD, but you know, you respond to what's presented, and fund responding to what's presented. So I guess, I don't know, it just seems like slicing it apart never made sense in terms of funding. So, I mean, I don't even know what the point I'm making here is. There's just that it's, just seems like everything that we fund should have an element of both.
Okay.
I would say the same thing differently, which is from my neuroscience viewpoint, this is just a silly argument that these are all brain-based driven behaviors, and we only have one brain. So this idea of slicing and dicing makes no sense. And to your point, you have to treat it as it comes in. So therefore, I just not willing to accept that we're going to have to pick and choose priorities here. The citizens of California certainly don't expect that, which is why, again, doubling down, and the contribution I can make is driving this sustainable finance strategy, which I believe we've found pathways to be able to radically grow our funding to address all of these issues. And that's what I think we need to fight for, as well as advocating with the legislature. It's not good enough for them to hold or reduce our budgets. We have needs out there that are critical, and we don't fix every other leg. So I agree.
I appreciate that. Commissioner Southard and then Commissioner Callan.
I have long believed that really true, not just on paper, integration of mental health and substance abuse disorders, so it's really treating co-occurring disorders, is the key to good outcomes. And that's where I think we should focus our work, is measuring the outcomes of programs connected with their ability to properly integrate. And in Los Angeles County, as I evaluated programs, some places said they had an integrated service, but until you looked at the outcomes, you couldn't tell for sure.
Through my own personal experience of SUD, SUD is a mental illness, and I think they go hand in hand. You can't help one without the other, basically. And I just thought this would be a good time to bring this up. Prior to being on the commission, I've been very involved in this, and there's people may have heard of Haven for Hope in San Antonio, Texas. They've had an enormous success for mental illness and substance use disorder, combining them in a multiple tier system. It's brought their home unhoused level down by, I think, 70% over a 10-year period. It's enormously successful. And I'm part of an envoy as a citizen, as an individual, on October 19th to look at the place. And they have been asking me, and I would really love the commission to have representation on this envoy. And I'd love to be one of them, and I'd love to ask anyone else who'd love to go, because I think we should go see things that are actually working. And I know that Las Vegas took a system just like this and brought it to Las Vegas, and they're saving an enormous amount of tax money by implementing these systems. And and I think there are also legislative issues that would go hand in hand with this. And I think I'm not pushing Haven for Hope, but an organization like this, we could bring all these other organizations together to work as sort of the spokes of a wheel to function more effectively. And I think so I don't know how I would approach this for October 18th, but I would love to have commissioners come and on this trip and just see how their model works. I've heard a lot about it, and they're also a group of tech people and industry people who want to do a model like this in California, and I'm wondering if the commission could be involved with that a bit too. So that's what I wanted to put out there.
Thanks, Commissioner Callan. I appreciate that. Please, Commissioner Fernandez.
I sort of want to echo the sentiments expressed here and relay that I so appreciate the commission's support of the aims under BHSA. And simultaneously, I want to highlight a few key areas that I think the commission should at least be aware of in terms of some of the key points where persons with substance use disorders or individuals who are direct operators in the substance use disorder field maybe feel a little bit left out in terms of how this rollout is taking place. And so I feel sort of particularly grateful that I have the unique opportunity to serve on the commission in a seat of a person with a substance use disorder. And I entered treatment at a community and county-funded organization in 2013 after experiencing homelessness when I arrived in Los Angeles. I'm the CEO of that organization today, and we operate somewhere north of 400 beds in Los Angeles County. And I also serve on the local community planning team, which is responsible for developing the integrated plan that will go to the Department of Healthcare Services. I agree with the sentiments that we want to offer integrated care, that we want to make sure that we're treating these conditions simultaneously. The first slide that Dr. Tsai shared highlighted the fact that there's a certain prevalence of persons that are experiencing severe mental illnesses or serious mental illnesses along with SUDs. The fact is that 50% of the individuals are accessing mental health treatment, but only 2% of those individuals are accessing only SUD treatment. What we see playing out in Los Angeles County is a system wherein the Department of Mental Health views this as a zero-sum game, and that they have to push mental health initiatives and cast SUD issues to the side in order to maintain funding for those mental health conditions that exist there. And while it's not the Commission's charter to actually approve those integrated plans, and that's delegated to the Department of Healthcare Services, it's something that folks should be aware of. The same thing happens when we're talking about Medi-Cal peer support specialists, which were recently rolled out across the state of California. The work that's done through CalMesa is incredible, but the truth is, of the 20 agencies that are now responsible for providing that education and training, very little of that training is specific to peers who have substance use disorders. And so the majority of training that's available out there is for peers who will seek to operate in mental health settings. And I, as an operator of a substance use disorder treatment program, desperately want to engage more certified peer support specialists in my settings. But the truth is, the education that they receive is not sufficient for treating the population of the individuals that we serve. Because yes, mental health diagnoses and substance use disorder diagnoses do often occur together in the same way that a chronic heart disease and hypertension or something like diabetes occur together, but that correlation does not necessarily mean that they are inextricably connected to one another. And in fact, they are unique diagnoses, and because they're unique diagnoses, they actually require unique interventions as well, and the clinicians who offer those interventions are distinct in their training. When we onboard individuals who are either marriage and family therapists or social workers, you can look at the curriculum of the individuals when they go to school. Marriage and family therapists spend something less than 8 hours over the 2 years of their education focusing on substance use disorder specific issues. And so I want to make sure that the Commission understands that behavioral health can't just be behavioral health in nomenclature. And if we want to meaningfully engage individuals with substance use disorders, then we need to view them in line with and equal to individuals with mental health diagnoses. That's part of the reason why I think Los Angeles County has been so successful in reducing drug overdose rates and making the headway that they have, because of the type of system that's allowed SUDs to take a stage and say, hey, we deserve an equal voice and we deserve equal treatment. And so that's part of the discussion questions I sort of want to highlight and candidly bring forward to the table here today.
Thank you for that. Yep, Commissioner Mitchell.
And I absolutely agree with that. I think a lot of it is, it's almost like substance use has an even higher stigma rate. So if you put these two together, mental health and substance use disorders, then if you put a weight on them, someone is going to say, well, the substance use, it's their fault. They want to stay out here on these drugs. So it's really the stigma. And absolutely, with the education and training for substance use versus mental health, I believe most of the curriculums in the university it's maybe a 1 semester course in SUD, which equates to maybe 30 hours or so versus an entire curriculum. So I think we need to do more education and boots on the ground, from a grassroots approach for treating SUD, because it does have to be right up there, literally equal with mental health. And I think that's where a lot of the problem lies. It's it's the stigma that's associated, and that stigma goes far and wide. It's cultural, it's economic, it's all those things that we talk about for marginalized communities. So I absolutely agree with that.
Thank you. Other commissioner comments and reflections? I just have one overarching question, Commissioner Fernandez, is like, I'm sort of thinking about this, like, at least as a child advocate, we talk a lot about behavioral health integration into like pediatric settings, and it's so hard, right? Like, no one has the training, the teams aren't working together, and I'm curious, as somebody who's completely new to the SUD world, does that infrastructure even exist? I heard Commissioner Tsai kind of chuckle when he said only one county actually has two separate departments. So I'm curious, can you talk a little bit, like, what is the landscape out there right now? Is there meaningful integration? Do they talk to one another? Or are we sort of a little bit at the beginning of this?
And that is a great question. There's 58 counties in Los Angeles, so you're right. So there are 57 in California. Sorry about that. I know everyone will jump down my throat. Sorry, commissioners.
We know California is its own state. We know. Los Angeles, excuse me.
Of the 58 counties in California, there is indeed only one that has a separate Department of Mental Health and a Department of Substance Abuse Prevention and Control, and the rest operate under systems where there's an integrated Department of Behavioral Health. The feedback from the field that I hear as a provider, not as an individual sort of with lived experience, when we contract with different counties, is that the substance use departments are often hamstrung by the decisions that are being made by the Department of Mental Health. And for context, in Los Angeles County, I think that the DMH budget is somewhere north of $4 billion, where the substance use budget is about $500 million. When you start pooling those types of resources together, the truth is that substance use becomes the political football, and when there's a funding cut, when you have that other party in the room making decisions on your behalf, I think we live and work in an environment where we realize that there's a finite amount of resources, and protectionism is a real thing, especially from longstanding institutions. And I think integration can and does exist in spurts throughout the state. I've seen and observed very meaningful sort of relationships occur at the CBO level between providers. The best type of integration that I've occurred, though, really is taking place when one provider sort of opts to join another provider space and knows firsthand, hey, I know XYZ program and they're doing fantastic work, and they can help our individuals with workforce readiness training, and they can help people get GEDs. And there's just a lack of communication in some instances between the CBOs about the services that are out there. In regards to the question, you asked about the infrastructure on the PED side of things. I don't know enough about that, except for that in Los Angeles County, for example, I believe there is a total of one adolescent residential provider that is contracted to provide residential Medi-Cal reimbursed services. And therefore, that provider contracts with a number of other counties throughout the state of California, not Los Angeles, to ensure that that is available for individuals in care. You all know that part of what happened under Prop 1 was also the funding through BHCIP. And so I'm hoping that there is indeed more infrastructure that's being built out throughout the state of California, not just in urban hubs like Los Angeles or in San Francisco, but across rural communities. The big issue that they are facing, again, is the same issue that a lot of industries will face, which is that if you build a brand new shiny building in a remote county like Shasta County, it's really hard to find a competent and trained workforce to administer and provide those services to the individuals that you're serving there. HCI has done a fantastic job of making available funding to increase the behavioral health workforce, but I believe that they just released a study 2 weeks ago that showed that of the sort of addiction psychiatrists that were meant to join into residency or join their first year, and I'm sure someone here will correct me because I'm completely paraphrasing this article, they were something like below 50% enrollment of where they had intended to be. So while the funding exists there today, clearly I think that we're still missing the mark somehow in terms of building out that infrastructure.
Commissioner Southard has his hand up still.
I was going to say that the in work that I did for the CERM, one of the things we did is the Department of State Hospitals had a contract for us to work with counties for incompetent to stand trial individuals. And one of the things that we found out was that some counties didn't have any infrastructure for dealing with the co-occurring disorder issues of the people who are incompetent to stand trial. So one of the things we got this Department of State Hospitals to do is to make sure that those outcome measures for integrated treatment were available in each county. And as people have said, some of the counties have truly integrated systems, and some of them it's just paper. And I think that's one of the things that we can do is try to find ways of keeping metrics on those counties that really have an equal co-occurring disorder treatment system. And the reason I'm very emotionally involved in this is that our son had a anxiety disorder that he treated with drugs, became a heroin addict, and nearly died several times, but has recovered and now has a medical license. So it's a miracle story that I think I've shared before, but it shows that integrated, and he didn't get better until he got true, honest to God integrated treatment.
That's something to follow up. Do you think, Brandon, it's also important to have the managed care, commercial managed care plans involved in any of this, this work? Because he just noted like a general anxiety or an anxiety disorder, which would be mild to moderate, drug use, moved him on a severe and persistent. I think people, what I've been hearing is that people have been trying to like, oh, we don't belong in mild to moderate, or so we don't need to engage the managed care plans. I mean, my disorder can go from substance use or mild to moderate to all over. What do you think about engagement of the managed care plans and around this integrated care?
I mean,
is that a silly question?
One, I think that like we absolutely need to like engage the managed care plans, and particularly when it comes to certain pieces of legislation, which I don't know what my parameters are for either promoting or not promoting a different legislation. But right now, there's legislation that's available that would sort of seek to increase the number of days that an individual would receive as a prior authorization for residential SUD treatment, because there is a huge disparity in terms of the number of days that an individual who's covered by Medi-Cal might receive versus someone who has a private insurance plan. Oftentimes we work with individuals and a managed care provider on the commercial side will authorize like an initial 3 days of residential for an individual who's coming from another county, whereas Medi-Cal will often offer just an immediate 60-day initial authorization. And as any of you might imagine, if somebody is coming from a different county, driving 6 or 7 hours to receive treatment in a residential setting, they're just landing. If you get a 3-day initial authorization, that's nowhere near enough time to treat that individual. And then providers get stuck in this battle where they're doing utilization reviews every 3, 4, 5 days, maybe every week. And that's a challenge. I agree with you that the managed care plans need to be more involved. And I'd invite the commissioners too, because I think part of the charge of the commission is that we're dealing with like serious and persistent mental illness and serious or severe substance use disorders. And so it's actually quite sort of simple to look and see like, what does the DSM-5 criteria say, and what's the distinction between a mild, moderate, or severe substance use disorder? And I think when you take a look at that, you'll be really surprised to see like in excess of 2, I believe you meet the criteria for a mild substance use disorder. In excess of, or between 2 to 5, it's moderate. 6 and above is a severe substance use disorder. It's actually quite an easy mark to hit, and people can sort of move on that scale quite quickly. And so yes, no, I don't think it's a silly question, and I agree wholeheartedly. The managed care plans need to do more and show up more.
Any other comments from commissioners before we open it up for the public to comment? Okay, Amariani, if you could please open it up to the public.
We currently have 3 public comments. The first one is from Vanessa. Your line is open.
Thank you so much, Commissioner Fernandez. I get so emotional, but thank you so much. Many of the people that I mentored through the 12-step process are residents at your treatment center. And I, as a youth, went through the treatment center. I found myself at 18 years old, drug addicted and pregnant, and ended up having my baby who was born addicted. I quickly found myself in a solitary confinement cell, you know, while still lactating, not understanding where my child was going to be. And it was through the treatment centers that I that I received the notion of family, of care, of love, because my mom, because of economic reasons, was still selling drugs. So the work that the substance use treatment providers provide is very important. And although I have backed into my mental health diagnosis and see my therapist once a week, I just can't emphasize the need to really elevate the participation of SUD providers and ensure that SUD treatment, Commissioner Fernandez, remains the way that you have laid out and that your predecessors have laid out. It's very important to note that, like you mentioned, you went through the treatment center, now you run that treatment center. It's very rare for somebody to start off at a psych hospital and end up running that psych hospital, because mental health and substance use, what the recovery looks like, is very different. And I'm very eager to help and support in any way. I think that integrating healthcare services within SUD treatment is really important because of the stigma that one of the commissioners earlier mentioned, that, you know, my sponsees that may have medical needs, the minute that the doctors know that they have a substance use disorder, all of a sudden, you know, they don't get treated in the same way. So I think innovation at the intersection of substance use, you know, could look like integrating healthcare services like the mobile, you know, clinics in a treatment center, just to test out what that would look like, and also providing an innovation project that would allow transportation to detox. So, you know, how can we, you know, drive around and see who wants to go to detox today, you know, matching the availability with the treatment center. Because I know, you know, for me, I would have to sleep outside of Tarzana treatment centers and call every day from that payphone, hoping I'd get a bed. And thankfully I had that experience, because I still know Tarzana's treatment center's phone number, which is 818-996-1051, in case I ever fall off the wagon. But God bless you, and please uplift perinatal treatment, you know, and preserve SUD residential treatment. And to the mental health folks, maybe we can learn from the SUD folks on what residential mental health treatment could look like outside of a psych hospital setting or a mental health rehabilitation center setting. Thank you.
Thank you, Vanessa. Our next comment is from Steve. Your line is open.
Can you hear me okay?
We can.
Okay, great. So for full disclosure, I do have a fan club for Vanessa Ramos here. I just saw her at the Cerritos Hospital, Disability Rights. If you haven't seen it, there's a real concern about Cerritos Hospital, where my son had been once on his journey. Thank you, Commissioner Fernandez. Thank you, Commissioner Tsai, and everyone else. Vulnerability helps me understand you all a little bit better. And once I add in Simon Sinek's Know My Why, I become an acquired taste of trying to get stuff done. I think people need to understand funding. SUD funding is about 1/10 of mental health. The BHSA will eliminate what we used to call MHSA. Every 3 years, we take the entire annual budget and it's gone based on the housing requirements and the 5% back to the state. Gary Sy is an unusual character. Maybe that's only why we only have one. If you could get 58 Gary Sys, you would have substance use more organized in the state. You want to see data, you go to Gary Sys Los Angeles. You want to see presentations? I will take a little bit with Commissioner Fernandez. I don't think the budgets are specific to SUD, DMC, ODS, and what used to be the BHSA or MHSA. So the similar departments running them, they're still required to be spent in certain ways. If everyone's not familiar, I will follow up with Brenda, but Department of Healthcare Services has all the prior MHSA plans for every county, multiple years on one page. They have the ODC Medi-Cal plans. Even though they're so long, we don't have single flowcharts in our county, at least, that explain how the money's being spent and integrated. And as Commissioner Rolette said, shame on the industry that doesn't understand patient first. I've seen a lot of presentation. Connection is the answer to a lot of our problems, and teaching, empowering all of us, everyone from the president to the guy who runs it to the overwhelmed family member. How to be a safe adult is a prevention strategy and trust building strategy that allows someone to own their own recovery. At least that's been my family's journey. And accepting and appreciating people for who they are. We can't underestimate the roadblock that exists within the current agencies who don't get a lot of training, certainly on the public sector, much less the private sector, and completely paid dramatically less. And finally, we
Thank you,
need
Steve.
to.
Your time is up. Please wrap up your comment.
I will wrap up. Just like with the CARE Act, we're going to have to set the boundaries of what BHSA is for substance use disorder, and also figure out, I'm not against it, don't take my comments that way, but we're also going to have to figure out this thing of you treat one first versus treat the other, and what the best practice actually is, and demonstrate that to an industry, to most counties who don't understand it at all. So thank you very much.
Thank you. Our next comment is from Catherine. Your line is open.
Okay, thank you. Again, my background is in substance use disorder. I ran the former State Department and also was Undersecretary of Corrections running programs. And the one thing that I've noticed quite a bit is that when we merge the two systems together, they're really perceived as mental health, not an integrated system. Most of the counties have people that work for mental health be their substance use coordinator. So what I have seen happen, a lot of good things since the department was merged into Department of Healthcare Services, but we've really lost a voice in that we had at one time by having a department. I mean, having said that, I think you, the commission, have an awesome opportunity here to really demonstrate what integration really looks like. It's not about having meetings every month about mental health and twice a year about substance use disorder, but that it's really balanced and equal. And I really appreciate you taking the time to do this educational session today with two of our great leaders. And I agree, if we had a Gary Sy, if we had 58 counties that had a Gary Sy in it, we probably wouldn't even be talking about integration being a problem.
Thank you, Catherine. That was our last public comment. Oh, I'm so sorry. Actually, we had two more come up. And then we also have Joe. Yes, go ahead. Oh, let me get you a mic.
Thank you.
Hi again, Joe Bonians with Shatterproof. Just want to echo some of the comments made by Kathy and others in the room, and just express appreciation for this agenda item. This can sometimes be the elephant in the room for behavioral health, and I appreciate that our leaders here are taking this head on, that the commission is taking this on, because behavioral health, while some might hear it as mental health and substance use, the fact that there's an assumption you have to make that might be left up for interpretation, that it's not clear, has implications in public policy and funding decisions and decisions that you make. And I'll just say, I mentioned that I'm new to Shatterproof and California's work. It has struck me, generally speaking, how other state level meetings and conversations, when behavioral health has been raised, there has not been a focus of substance use disorder, which is why I also appreciate that this conversation is happening right now. I also want to acknowledge that it's on us stakeholders also to be present and speak up and inform your work and decisions. And so with that in mind, I ask you to continue to give the substance use disorder community this type of attention and commitment, because as Dr. Tsai mentioned, Commissioner Fernandez said too, there's a tremendous need and a lot of potential for good. So before I wrap up, I just want to say, because I know stigma has been an issue, and mentioned here that Shatterproof also has a DHCS funded partnership called Unshamed California. Some of you all might be familiar. That is specifically aimed at reducing substance disorder stigma by telling stories of people impacted by substance use disorder. So I know many of you shared your stories, and I think that sticks with us, and we're working with the state to do that, and I want you all to know that as well. So I'll just say thank you for your attention and commitment to those in the community. Appreciate the time.
Our next comment is from Dr. Mohammed. Your line is open.
Good afternoon, everyone. Good afternoon, commissioners. I'm Dr. Isranullah Mohammed, a clinical psychologist, systems equity advocate, and author of the Beer Care to Custody Cemetery Pipeline and the B2C3A Pipeline Prevention Model, which was entered into the public record on April 10, 2025 under U.S. copyright law. Today's question is how to integrate substance use disorder into the Commission's portfolio. The answer begins with urgency and ends with design. 2/3 of American families report substance use disorder suffering. Fewer than 15% received any treatment, and only 5% reached specialty substance use disorder care. If we build capacity without access or accountability, we build delay. If we build beds without evidence-based prevention or lived expertise, we build abandonment. If we build systems without metrics, we build excuses. We can do better by design. First, recognition that strengthens public trust. Where your work converges with the Beer Care to Custody Cemetery Pipeline, adopt a neutral prior work line in the record. Concepts overlap with the evidence-based Beer Care to Custody Cemetery Pipeline and the B2C3A Pipeline Prevention Model. This is recognition only. I'm not disclosing any methods, and I'm not asking you to slow down. Second, portfolio guardrails that travel with every dollar. In grants, advocacy contracts, legislation, and data, please require assertive, field-based initiation of substance use disorder care, lived expertise, and navigation teams that include peers and families. Third, governance with cadence. 3 months, the commission did not meet, even though families were suffering, being displaced, and experiencing barriers to access. Publish a crosswalk and timeline showing exactly how substance use disorder integrates across committees, including research, pilots, advocacy, legislation, and data. with named owners, lived experience roles, and dates the public can follow. Because the pipeline has a name, Bureau Care to custody to cemetery, and prevention has a model. Let's move from empathy to mechanism, from promise to proof, and let the Behavioral Health Services Act dollar really interrupt the pipeline before it becomes a headline. Thank you.
Thank you. Our next public comment is from Moran. Your line is open.
Hi, I just want to echo Commissioner Rachel's brilliant idea to ensure that the managed care plans cover SUD services by collaborating with the peer support services and counties. Thank you.
Thank you. That was our last public comment.
Thank you, Mariani, and thanks again, members of the public. Thank you, Commissioner Fernandez, for, oh, just kidding. Please give us your
I
comment.
want to close with a quick anecdote that I'm going to invite the commission in to sort of consider, which is this. Cry Help was funded under some of these BHSIP programs, which means that we went out to RFP with a number of different architects. We were told by some of the leading behavioral health architecture firms that they had built thousands of behavioral health beds across the nation and globally in some instances. What I invite the commission to do and really challenge you to do is that when you hear someone, a colleague, a family member, or if you read in the press someone use the term behavioral health, actually ask them what they are saying, because one of the leading architecture firms that told us that they had built over 1,000 behavioral health beds in the United States, when we really dug down and asked them, what they really meant was that they had built acute freestanding psychiatric hospitals, PUFs, MHRCs, and SRFs. Of those 1,000 beds, they had built a total of 1 residential SUD facility with 52 beds. And so we need to make sure that when we're using the term behavioral health, we know what that vocabulary means. Thank you.
Appreciate that. Thank you. Thank you for that great reminder and for lending your expertise and leadership to the commission. We appreciate you. At this time, I'd like to inform our commission and members of the public that we have lost quorum. So therefore, we are not allowed to talk about the next 2 items. So a couple of thoughts. We had 2 items left for information purposes, not action. The first was around our Behavioral Health Student Services Act, and in particular, our administrative and evaluation planning for that grant, as well as an update on our advocacy contract strategy. Both of those items are critical responsibilities of the commission in this new environment. So I am requesting some homework from our commission as we prepare for the October meeting, where we will have time for this discussion, to please review those materials. We want to be able to hit the ground running, and these are both important, again, responsibilities of the commission in this new environment. So if you could do that, very much appreciate your time and attention. I also want to remind commissioners that there are calendar invites that go out to you in hopes that we get a good sense of quorum and planning. With the discussion today around calendaring the next year and a half of activity, roughly, to the extent that you can accept those invites or give feedback on those dates, we really appreciate. The staff is working hard to ensure we have the necessary supports and resources to make those meetings successful, and that is only possible if you respond. So just a friendly reminder. We had really, really intense conversations today, and I just want to thank you for your time, commitment, your expertise, and your partnership in this important work. And I hope you all get some rest this weekend. Thank you. This meeting is adjourned.